To everybody. It's lovely to see such a full room. I will now introduce myself and then I'll ask the panel to introduce themselves to you. But then if you're an officer or a member of the public, if it's your, if you're speaking, if you could introduce yourself, that would be helpful for us all. Thank you. So my name's Dina Romero and I am a councillor for Southdown and I chair this meeting. Liz.
Good morning, I'm Liz Hardman. I'm Councillor for Poulton and I am Vice Chair of this panel.
Onkar, is your... Shall I move to David first? I'll come back to you. David.
David Harding, Councillor for the Chew Valley Ward.
Michael Orton, I'm Councillor for Midsummer North.
Councillor Onkar, Coomdown Ward.
Joanna.
Councillor Wright, Lambridge Ward.
Paul.
Councillor Crosby, Southdown Ward.
Kevin.
Morning, Kevin Burnett, Professional Association rep for the NEHT, co-opted member and a non-voting member of the panel.
Chris.
Christopher Batten, representing National Education Union, non-voting member.
Leslie.
Thank you.
Morning everyone, Leslie Mansell, Councillor for Radstock.
And Mark, are you ready?
Yes, Chair. Good morning everyone, my name is Mark Durnford, I'm the Democratic Services Officer. Thank you.
And Kerry.
Morning, Kerry Williams, and I provide the Scrutiny Officer support to the panel.
So have I missed anybody on the panel? As you'll note, you know, the panel is sort of dispersed around the room. So I'm now going to turn to Mark, who's going to tell us what to do if there's an emergency.
Yeah, great, thank you, Chair. So if the continuous alarm does sound, you must evacuate the building and proceed to the assembly point. From this room, you follow the green running person signs to the exit, using either the marble staircase or the main staircase. Please not use the lifts. The assembly point for this building is the Orange Grove grassed area, just outside Brown's Restaurant, and there is an evacuation chair for use by disabled people who so wish in the corridor outside the Council Chamber Public Gallery. Alternatively, the area at the top of the marble staircase has been designated as a safe refuge where persons needing assistance should assemble. Thank you.
Thank you, Mark. We now move on to apologies for absence and substitutions. I don't believe we have any. I'm just checking.
Not that I'm aware of, Chair, no.
Oh, that's not quite true, Suze. We do have an apology. We do have one from Suzanne. Yes, but I believe Darryl will be covering in her absence. So, any declarations of interest to note? Michael?
I just need to say that my full-time job with Community Catalyst is funded through Baines, working with adult social care, so I just felt too important just to make that clear because we're talking a bit about that today.
Thank you. And I have no urgent business to share. And now we move on to public and councillor statements and questions. I think I'm looking for Cindy Carter. Hopefully. And then I think you're going to be followed by, is it your husband? Okay, brilliant. So if you'd like to make a start on your statement. Thank you.
Lovely. Good morning, everyone. Thank you. Chair, members of the committee, I'm here in my capacity as a Court of Protection appointed joint in several deputies.
Cindy, do you mind if I stop you there? If you speak more directly into the microphone, it will just be a little bit louder for us all. Thank you.
Lovely. Is that better?
Yeah. Thank you, Joanna.
Lovely. Okay. Is that better? Fantastic. Chair, members of the committee, I'm here in my capacity as Court of Protection appointed joint and several deputy for a young man who has profound learning disability and complex healthcare needs, living in supported living in Baines and also as his mum. I appreciate the difficult budgetary decisions facing Council. The current budget consultation proposes achieving savings through recommissioning of learning disability care and support services and through Care Act reviews with a stronger focus on cost effectiveness. Whilst these are described as efficiency measures for people with profound learning disability and complex healthcare needs, they have real consequences for how care is commissioned, reviewed and delivered. These disabilities are lifelong, and enablement will unlikely be a solution in meeting Care Act assessed needs. For people like my son, care is not optional or flexible. It relies on stable providers, skilled staff, and consistent, trusted support. Cost-driven changes can reduce staffing levels, lower skill mixes, disrupt continuity, destabilize providers, and encourage standardized models that are wholly inappropriate for complex needs. These are not abstract concerns. They can lead to safeguarding risks, deterioration in health, loss of skills, and more restrictive support rather than greater independence. A key concern is timing. Savings are being consulted on now, while the recommissioning framework shaping future services is still in early development and expected to evolve through 2026. People with learning disabilities are a protected group under the Equality Act. An equality impact assessment has been completed, but it is based on broad intentions rather than detailed proposals. Small changes in commissioning or review practices can have disproportionately large impacts, so careful mitigation is essential as proposals develop. Co-production is a statutory requirement under the Care Act 2014. At present, there has been limited meaningful involvement of people with learning disabilities, their families, or court-appointed deputies on proposals. Strengthening engagement would help ensure decisions reflect how services work in practice, supporting continuity and stability for those most affected. There are positive local examples to build on. The commissioning of respite provision at Newton House has shown the value of co-production, user choice and continuity of care. I encourage the Council to apply these lessons to recommissioning of supported living services, so future models are shaped by lived experience and deliver the stability, quality and outcomes that matter most to individuals and families. Thank you for your time and consideration.
Thank you. If Alan Carter wants to make his statement now, and then if you would be happy, I'm sure the panel might have a couple of questions they might want to ask of you.
Chair, members of the committee, I'm here as Dad and as a Court of Protection appointed joint and several. Chair, members of the committee, I'm here as a dad and as a Court of Protection appointed joint and several deputy for my son, who has a profound learning disability and complex health care needs. He lives in supported living and relies on commissioned care and support to meet his needs safely and lawfully. The committee will be considering proposed local authority budget proposals, which include changes affecting people with learning disabilities through care package reviews and recommissioning of services. These proposals sit alongside financial pressures within the ICB, which also impact learning disability services. In this context, we are seeing challenges between Baines Council and BSW ICB in determining which organisation is responsible for meeting assessed needs under the Care Act. These are not abstract issues. These arise in day-to-day care planning. While funding responsibilities are clarified, care can be delayed or questioned. Families and deputies are placed in the position of helping resolve funding disputes between Baines Council and the BSW ICB, causing uncertainty and stress. And people with learning disabilities may face increased risk. The law is clear. Care Act assessed needs must be met, and funding disagreements must not disrupt care. We recognise the pressures on both organisations, but these duties remain critical and statutory. When a service is proposed to meet a need in a different way, it must still fully address the assessed need. We would encourage the committee to consider not only the cumulative impact of proposed budget changes on people with learning disabilities, particularly those living on the minimum income guarantee, which is below the poverty line, but also the potential equality impacts on those with profound learning disabilities and complex healthcare needs. It is equally important to consider how the joint working between the local authority and the ICB can be strengthened so that care delivery is not adversely impacted. Specifically, we would ask the committee to explore how joint responsibilities are defined and consistently applied. What mechanisms exist to resolve disputes without impacting care? And what assurances can be given that people with learning disabilities are not left with unmet statutory needs due to cost shifting? This is not simply a financial issue. It is about ensuring that public bodies work together effectively to uphold their legal and ethical duties to some of the most vulnerable citizens. By approaching these challenges collaboratively, we can ensure that care remains safe, reliable, and person-centred. Thank you for your time and consideration.
Thank you. Are you happy to take just a question or two? Okay. Does the panel have any questions? Liz.
Thank you very much for speaking today. Firstly, Cindy, if you don't mind me calling you Cindy, could I ask you, Cindy, you've raised this problem and you're seeking assurances about the commissioning framework for supported living circumstances. Have you heard something about this? Is that why you are here? Has it been made known to you by a social worker or somebody in authority that changes are going to be in place? Because I just wonder why you are here regarding recommissioning of the framework for supported circumstances.
Thank you for the question. That's one of our concerns, because actually the recommissioning framework has not yet been published, so it's very unclear as to what the proposals are. They propose budget savings around the recommissioning framework, but as parents we're uncertain of what that means, what the impacts mean, particularly in terms of equality considerations.
Thank you. Could I just say that we will be discussing this later on, and I think that there are people within the panel who will be asking questions like that of our officers, so we will be addressing that. But with the Chair's permission, I'd like to ask Alan, if that's okay to call you Alan, a question. You've raised concerns regarding the relationship between the ICB and Baines social work, and the fact that there is not an agreement between them, and the care for your son is challenged between each of these organisations. Again, we will have a member from the ICB speaking to us, so this is something that we can explore with them. But I would ask you to say a little bit more about this, Alan, because we're not aware of this.
Sorry, we both cover these issues. Perhaps I can pick up on that. So there are different ways of funding hearing support. Some people are funded through CHC funding, where there is a primary healthcare need. Some people have a combined package where there's both social care need and also healthcare funding. And some people are funded solely through council. Where there is funding, in both cases through the ICB and through the council, one of the issues that can arise is what is a social care need and what is a health care need. And this is where one finds particular issues coming up and difficulties, because as parents you would have to try and work your way through the system, and you have to work your way through both systems, and it's very complex.
Thank you very much. Thank you. That's very clear.
Thank you. Joanna and then David.
Yes, I was going to follow up on that point about the social care and the healthcare needs and how different the ICB and Baines work together. How many disputes are you aware of that have taken place for others as well as what I consider possibly yourselves as well? And I certainly know that we've been asked questions about the child's system of SEND and the complexity of that. So I can see that there's a complexity here that probably expects a certain level of education and knowledge and background to work through. And if you don't have that, and if you are a person who has complex needs or are responsible for somebody and you don't have the capacity to get through that, how challenging is it?
Yes, thank you, Councillor Wright. That's a very good question. It is very difficult to work into complex social care and healthcare systems, particularly as they evolve. And I think it highlights the real importance of co-production. Co-production means working with families who have to actually access these systems and work through these systems. And so what we are trying to support is that co-production takes place. It is very difficult, and you're working into very difficult financial systems as well, because funding works differently depending on which route you're funded through. So if you are funded through local authority support, a person lives on something called the minimum income guarantee, which, as Alan has said, is below the poverty line. I think what is starting to happen is there's much stronger focus on what is a Care Act assessed need. And if it's not a Care Act assessed need, the person is responsible for that. And that's where it becomes quite problematic, because sometimes I think there's not the understanding of people who are making the decision as to what the financial position is of that person, saying that potentially they can be, they should pay for that through other mechanisms. But, they live on the minimum income guarantee. So that is really difficult.
Chair, I'm just wondering if we should have some kind of report on this detail for a future scrutiny meeting, because a bit like with the SEND, we're given bits at different points, but not the whole picture. And there clearly is something going on here, and it's very hard for us as a committee to just pull this out in a fair way.
No, I'm happy to take that suggestion, but obviously we will be having a discussion on the budget, and obviously we've got the Cabinet Members' report too. I think, yes, I'm saying yes, we will have the
But there
report.
does seem to be an issue about the ICB and Baines
to...
and how it works together and the collaboration. And we have bits from either of them, but never a joint thing. So I think there needs to be more work on that. Thank you.
Next I have David and then Leslie.
Thank you, Chair. Thank you for coming to speak to us. The difficulty of navigating two systems, I fully get it. I was just wondering if you'd be able to either now or write to us a little bit about some of the practical things that happen at that interface, because I'm not living your experience, so I don't understand what that might actually look like. And that's quite a complex question, I guess, so I'm very happy if you would write to us with it if that's too difficult for now.
Yeah, I mean, we can provide practical examples, but obviously for confidentiality and safeguarding reasons, we're in public forum and obviously formal meeting minutes, and it's as relates to vulnerable people. So certainly if there is co-production in terms of training for the committee, one can potentially highlight some of the complexities around this. I'm happy to give an example, for instance. So where there is a Care Act assessed need, okay, there's a statutory responsibility to meet the assessed need. So, for instance, you might get something like chiropody, where it's not a social care need, potentially, whereas health might say, well, it's not for health, it should be paid for by disability-related expenses. And that comes off your social care funding. And so, therefore, you sit in the middle of that dispute, as it were, trying to resolve it through both different systems. And the way to resolve it, or the way you have to look to resolve it, is through the complaints process, which is a very long and onerous process. There is lots of legislation, ombudsman ruling out there, but that is currently the route that one has to go through. I think there's also a matter of support from social workers. So certainly we would encourage named social workers. Currently there's no named social worker system for people with profound disabilities. So you're also working into a system where you're talking to lots of different social workers who don't really understand the person or the actual assessed need, and are making assumptions around the assessed need. So that just perhaps helps outline some of the complexities that you're working with. And obviously you're also working in the context of having to support a person with profound disabilities.
Thank you. I'm going to ask Leslie to ask her question, but I'm just giving a bit of warning to Darren and Alison and Lucy. So I think it would be useful to have your response as well to the statement that's been made. It's obviously very complicated, lots of issues there. So it'd be useful, I think, to get some initial feedback as well, and also around the point that Joanna was making about a future report on the sort of general issues. As opposed to this explicit example. Leslie.
Yes, thank you both for coming along, and really appreciate you sharing your personal experiences here with us. It's really important that we have a grasp of what is happening. I don't know if you're aware that there is a new engagement officer here at Baines. I think they started back in October. So are you aware of that? And more important, you mentioned it quite a lot. I mean, one of the government principles is around co-production. How do you think that we can, with the ICB, make sure that co-production is meaningful and embedded and not just episodic? Thank you.
Yes, so co-production, I think is key. I wasn't aware of the engagement officer. I have had some contact, or I followed up with a gentleman, Callum, I forget his surname, who's leading on co-production. But yes, co-production is absolutely key. And we have been asking for co-production for some time. You'll see previous minutes of the meeting. Alan asked various questions on co-production. There are lots of mechanisms out there in which co-production can take place, because obviously when you're working with people with learning disabilities, there's quite a wide continuum from people with mild, moderate learning disabilities all the way through to people with very profound and complex learning disabilities. The way of co-production is different. Obviously, you would have heard of, for instance, Swallow. Swallow have a day where they have discussions with their members as to what services they would like to see. I think that is a really useful way of co-production taking place. The other thing is, obviously, if you're dealing with very complex learning disability, you have deputies in place who have worked into the system for many, many years, and are one of the few peoples who understand how the whole system actually fits together. And I think engaging with those parents as well, and obviously there would have been some engagement with parents at Newton House, and the outcome of securing Newton House as a respite facility going forward. So I think those are key. But in this instance, we have to be asked, you know, otherwise we're left with having to come to committee to actually give our opinions. So I think that hopefully that answers part of the question. In this case, why we came to committee is obviously the budget is coming up for consideration, for decision making, and yet people who are going to be effective have not been, they don't understand what the potential implications are. Thank you.
Thank you. So I will now turn to, I don't know in what order you wish to do this, but if you could introduce yourselves as well, I think that would be great for the panel's benefit, for people who might be watching online, and also obviously for Mr. and Mrs. Carter.
If I can just start, and then I'll ask Anne to say something. So first of all, can I thank you, Mr. and Mrs. Carter. We haven't met yet. I'm Darrell Freeman. I'm the Executive Director. But I have been part of an email exchange that you've had with Suzanne in recent weeks. So I want to thank you both for your contribution today and for that thoughtful exchange of emails. And I know that you and Suzanne are committed to having a further conversation. In relation to the specific question, if I hand over to Claire on the issue. Anne, sorry. Yes,
Good morning, Scrutiny. My name is Anne Smith. I'm the Assistant Director for Adult Social Care Operational Services. And thank you, Mr. and Mrs. Carter. I know we've had a conversation before Scrutiny. If I take the questions around joint funding first, so we have over 400 individuals who have some kind of joint funding between adult social care and our health colleagues. Most of those arrangements work very smoothly. I am aware of Mr. and Mrs. Carter's individual circumstances, as is Lucy, where we've been having some conversation. So absolutely we could bring a high-level report to scrutiny without sharing any identifiable information about the number of people who are joint funded, how that process works, how we work through issues of disagreement or come to conclusions around pragmatic ways of meeting those individual needs, and hopefully we will get to a resolution for your son, Mr. and Mrs. Carter. If I pick up then around what adult social care can and cannot fund, it is not actually lawful for adult social care to fund care that should be the purview of health services. That doesn't mean to say that we don't have lots and lots of individuals whose health needs are ancillary or alongside those social care needs. Providing someone's medication is a really common example where we may be going in to support someone's personal care and they need medication alongside that. Adult social care will do that as part of that package of support. But if somebody just required a visit for medication, that wouldn't be an adult social care need. It would fall to health services, and that doesn't just mean the ICB funding individual visits. We obviously look to our primary and secondary care partners, but mainly our primary care partners out of health services in the community. So again, as part of that ask for scrutiny, we can bring some detail around, again, the sorts of things that adult social care and health are obliged to meet and where those crossovers are. If I turn to the issue of named social workers, for people with learning disabilities, it was a recommendation 20 or more years ago in Valuing People Now around named social workers for people with learning disabilities. We do not have the resource of social workers or social care practitioners within the teams for everybody to have a named social worker, and not everybody does. But I fully recognise when we're talking about people with very complex needs across our population, that is something that we need to be looking towards, so that people at least have a named point of contact, whether that is the person who then goes out and does that visit. So certainly, Mr and Mrs Carter, that is something I will take on board, and it's certainly something that families involved with Newton House have raised as well. So I'll leave my responses there, if that's okay, Chair. Thank you.
Thank you. And Lucy.
Thanks. Hi everyone, I'm Lucy Baker. I'm the Director of Learning Disability, Autism, Neurodivergence, children and young people and the combined place team. I'm also covering the duties of the Executive Director of Place for the ICB at the moment. Echo my thanks to Dr and Mrs Carter. I have had the pleasure of talking to Cindy on a number of occasions about their son. In terms of answering the questions, we will, as an ICB, be providing a full response to Dr and Mrs Carter's concerns, and we will do that with them in terms of the personal detail. Just to echo in terms of Anne's summary, we in the NHS also have statutory responsibilities around what isn't and isn't our responsibility around funding, with the majority of funding delivered through Health Commission services. I would like to add that we have really strengthened, I think, the way we make joint funding decisions between the local authority and the ICB. We recently reviewed a number of cases and we did that collaboratively for the first time. But I think it's important we listen to the feedback today, and as Anne said, very happy to bring back further information to the committee with a joint paper moving forward.
Thank you. You've answered my question, which was going to be, can we make sure that is a joint paper? So, thank you very much. And I hope, Dr and Mrs Carter, that those responses help and answer some of your questions. And of course, you're more than welcome to stay for this meeting and hear the discussions, and you're more than welcome to come again, particularly when that joint report comes to this committee. And thank you once again for your statements. I have two more speakers. I'm going to take, I think, Eleanor, you wanted to speak, and then I will turn to Rosie for your statement.
The technology to work. Can you hear me all right?
I can hear you loud and clear.
Right. Otherwise, I'll just stand up and shout, of course.
Could you also say who you are?
You're taking the words out of my mouth, Chair. I'm Eleanor Jackson. I represent Westfield in northeast Somerset, right on the fringes of civilization where you cross over into Somerset. I have the privilege of having in my ward both the Swallows charity, and I've got to know the members of this charity very well, and the group that I call the Swallows Mums, who meet regularly to support each other. The charity exists to enable children and young people, but they seem to be getting older, as it were, to maximise their potential through education and training and enjoyable social activities. And I also have in my ward the Fossway School and the Fossway House, which has been somewhat controversial. And it's from this that I have learned a lot about the problems which Dr. Carter and Mrs. Carter have elaborated so clearly, and it resonates. If you are a ward councillor, of course, you have this perennial problem that somebody comes and presents you with a really complex situation and all kinds of difficulties with the council, and I could have brought, of course, some of the Swallows Mums with me, but you don't know if it's typical. And I think the officers should be complimented on the report they've put together, or the way it's presented, that working through this over the weekend, I got a much better rounded picture of the situation and the problems. I was interested in the complaints, of course, but I think the people I work with, many of them don't even know there is a complaints procedure. Never mind whether they might or might not have some justification because they haven't seen a social worker for a year or something or other, whatever it is. There needs to be, if I might say so, perhaps better communication. And look it up on the internet. It isn't going to do it for a lot of people. I am concerned about the fact that we are expected in the budget to make savings of X number, 4.6 I think it is, and I'm wondering how this is going to be achieved. Is it going to be fewer hours? And in my simple mind, it's not a question of reduction of the amount of money that's spent on adult social care and related problems that matters. It's delivering a better quality and using the money fully. So to take a potential sum away, I find very, very difficult. And I've been thinking about this. What could be done? You could say to make it more efficient, to make it more AI dependent, but as I said, I'm not sure that would work for a lot of people. How can you do like the Swallows do and include the clients in the decision making? It doesn't always appear to happen. I thought about a couple of rather practical ways you could save money in the general budget, not in this particular one. I have to inject insulin as a diabetic. I am required by the council to put the tub of sharps in my garden overnight for members of the waste team to come and collect. I think this is quite unacceptable because A, it tells my neighbours I have to inject insulin, and I might not want them to know that. B, ecologically, I live in a rural area. It's all too likely that an animal could come and get hold of the tub. But then, you know, surely our council officers have got better things to do than to go around collecting plastic tubs full of needles. So I would suggest that, and I'm very glad to see that in these papers there is going to be a review of contracts, but I would suggest something a bit more efficient. There's also a couple of teams at the RUH who don't seem to be able to get your follow-up appointments out before the appointment actually happens. There's something seriously wrong with the AI procedure for booking appointments in particular sections of the RUH. And of course this wastes money. If somebody's assigned an appointment, I got the information at the actual time of one of my appointments. There was no way I could get up to the RUH. I was getting on a train to Portsmouth. I mean, there must be a better way of doing things to iron these things out. But how can we do the whole generality? And I was very interested in co-production. I also think that possibly, I've seen some very good examples of it, co-working with charities like the CAB, the RNIB, Macmillan and so on, could also advance things. So I'm very interested to see, as we get older, we get more infirm, as we have more complex needs from birth, how Baines will rise up to this challenge and make it a good place for people so-called disabled, but I think that they've got an awful lot to offer, how we can get all the members of the society that we live in to contribute. So thank you very much for listening to me. I won't start on the subject of buses, but good. It's a question of getting information out to people that matters, and I hope that this council is going to consider how best they can do that. Thank you for your time.
Thank you, Eleanor. I don't know if anybody has any questions they wish to ask of Eleanor, or if any officer wishes to respond to the comments that have been made. Otherwise, as ever, Eleanor, thank you very much for your statement, and you will be more than welcome to attend our meeting when the report comes, that joint report, which obviously I'm sure will highlight co-production as much as any of the other points that you've mentioned in your statement today. Okay, thank you. And I'd now like to ask Rosie Phillips if she would like to make her statement. And as everyone else, Rosie, if you could introduce yourself, that would be wonderful.
Hello, I'm Rosie Phillips, Chief Executive of Developing Health and Independence. And it was good to hear the previous two speakers, because I think there's quite a few echoes of what you've said in what I'm about to say. And also just to say, we have a piece going out in Charity Times about lived experience because of DHI's sort of extensive work in that area. But yeah. Thank you for giving me the opportunity to speak this morning. And I also want to acknowledge that it's an incredibly difficult climate for everyone, for the council as well as charities. However, in this difficult climate, I think communication becomes even more important so that we can plan and do the best. However, I wanted to start with a positive story. which was, some of you might have seen because it's the first story we've ever put out that's gone viral. We had a story of Jeremy Palmer, who's a local Twerton boy who had a long history of offending and substance misuse, who 15 years ago came to DHI, and he's worked now for DHI for quite a number of years, but he's recently been given the post of supported housing manager for our dry houses. And it was really a very warming story to see all the positive comments on social media, which isn't always the most positive of places. But stories like Jeremy's don't happen by luck. They depend on stable, skilled, locally rooted services that understand their communities. And that's what DHI has delivered in Baines for decades, the past 26 years. We still provide drug and alcohol treatment services in Baines, housing advised criminal justice services, and work with homeless people through outreach. As a social inclusion charity, we work to reintegrate people long-term into their communities. And as a charity, we have always delivered very value-for-money services with a lean infrastructure because we prioritise our funding on frontline services. But the reality is that DHI has come under significant financial strain, and I know we're not alone, but I'm speaking for DHI at the moment. The most damaging change was the loss of the Baines drug and alcohol treatment contract, which we held since it first started in Baines over 20 years ago. A large national provider with a strong bid writing team secured it, and I hope they will deliver what was promised. And I would strongly encourage scrutiny to ensure that the significant promises and commitments they made are met. After losing the treatment service, however, it's not just the loss of the service. It's their big contracts drug treatment. It was over £2 million, which meant that the charity had to make over £250,000 of savings in its core service, the support services. We protect frontline work, which meant our central services are now exceptionally thin. For example, we had a team with 2.5 staff in our fundraising and communications team, which helped to bring in additional income into Baines, so the Children in Need post, and certainly over £200,000 the previous year. That team has been restructured, and now we have one communications and fundraising worker. Obviously, that will reduce further funding that comes into our services. Leadership and back office posts have been reduced to a minimum viable level, with much of the organisation's burden carried by a very small team, including myself. And sickness levels start to increase because of the stress it puts on people. We're now anxiously awaiting the next stage and hoping that we're not too scathed by further cuts. We are aware that the Reach Housing service will be cut by approximately a third, but not by the exact amount. We are resigned to that and working around how we can remodel that service in order to manage that, but we still don't know what that figure will be. I've spoken before about the impact Reach has on services, including statutory duties of the Council and the Housing Options team. I personally feel that by removing a third of that service, it will put more burden onto already stretched statutory services and ultimately increase cost. We're also waiting to hear about outreach funding where I should also say Reach is going from a contract to a grant fund, which also creates more instability because it's harder to plan and for our trustees to invest when you have that annual anxiety and stress. And we've lost 3 staff recently to the council who, because of the uncertainty, they've taken posts. One was possibly even poached, but that's anyway. What I wanted to say is that the cumulative impact of these decisions and the lack of communication is profound. We know there are cuts and we know we have to manage some level of this, but if we stand a chance of managing the cuts and the zero inflation, because that's also been part of the picture of cuts over the last probably 8 years. We've had very little uplift. We need to be consulted and we need to be able to plan. As a charity, I feel we are very much at DHI in that proud tradition of charities managing to be innovative and to find ways to meet unmet need. Lived experience is a significant part of what we do, and we get funding in to enable us to train those with lived experience to become qualified, and many of them work for us. That also keeps our costs down too. However, I will say that while I feel we have been responsive and committed partners, in recent years I felt deeply let down by how we've been treated and by lack of communications. These decisions and poor communications jeopardise not only individual services, but the future of services like DHI as trusted local partners, and I believe your local partners are a really valuable part of what you have. And the consequences will be real: more homelessness, greater strain on statutory services, and fewer opportunities for people like Jeremy to rebuild their lives. Thank you.
Thank you, Rosie, and thank you for sharing, first of all, a really positive story, which I think is still available through social media, and I'm sure on your own pages.
Somerset Live posted it on their Facebook, but yes, we'll post it on ours as well. Yeah.
That's fantastic. So if you didn't manage to catch that story, then it's still available. And thank you also for reminding us all about the complexities. You know, so a cut to one agency actually might have quite significant impacts. Are there any questions from the panel? Liz?
Well, firstly, I am deeply sorry about what has happened, but obviously it's not in our control, and it's all about the procurement process which takes place. But there is something that we can talk about in the contract cuts, and also, I believe, in the Cabinet report, agenda item 8, is that there is a vagueness about the contract cuts in the budget. The top 25 contracts, I think we mentioned this actually in our pre-meeting, are not being named. So I think we need to illustrate that, that needs to be illustrated better. But I do thank you, Rosie, for you and DHI and all that you've done. And I'm assuming that the cuts have had an impact on our local population. So you have mentioned that there's going to be increased homelessness. Is there anything else that you think that we should be thinking about and be prepared for?
Well, I think homelessness, or street homelessness, is the tip of the iceberg. But I think as you move sort of backwards up that chain, that's probably where the bigger impact is. You know, there is a lot of there's a move, isn't there, to try and stop families being accommodated in temporary accommodation. But you know, if those preventative services aren't there, you're going to find more people rather than fewer people. And I think it has that cumulative impact, more strain on the whole system ultimately. And also just in terms of the impact on a more individual level, for any child brought up in temporary accommodation or in that sort of insecure environment, and that's probably more the client group that Reach would work with, they're much more likely to end up children going truant, having problems with their education, and actually ending up in the system some way considerably down the line. They're more likely to offend, they're more likely to end up in prison. I mean, their sort of life chances are severely hampered.
Thank you. And I have Michael, and then Joanna, and then I think Kevin. So Michael first.
Yeah, thank you very much for your presentation. As a ward councillor for Midsummer Norton, and I know that probably my other fellow councillors that are out in the Soma Valley area, we tend to feel often the services get neglected out in that area. I've been in contact with DHI services because of one of my ward residents, but I would be interested in knowing more about what the services are that you're doing out in the Midsummer Norton area, and whether at some point we could maybe arrange to meet and I could get a better feel of the services so that we can be much more informed about how we can support you at the moment.
Rosie's nodding.
Yes, well, it sounded like an invitation to meet up and chat. Yes, definitely. Obviously, we no longer provide the drug treatment service in Midsummer Norton, but we are providing the REACH service still goes out there and does a surgery. So,
thank you, Rosie. And I have Joanna and then Kevin.
Thank you. When was the last time you had a meeting with the council on matters to do with budgets?
I think we asked for a meeting with Anne and Graham going back in the autumn, and yeah, we've been told to keep patient, and I've been trying. It's not one of my strengths. But yeah.
So when was the last time you had a meeting with officers?
I think about November, maybe.
Okay.
That was one we asked for.
That was one you asked for, but did you get the meeting?
Yes.
Okay. Okay, and what was the process in that meeting to discuss the issues that you've outlined today?
To sort of try and, I think, quell some of our anxiety about not having heard about the housing services, which is obviously REACH and Outreach, to say that it's likely that REACH would be cut by a third, but it would be funded, which in some ways felt like a little bit of a relief, which is a sad state of affairs. But and yeah, and we need to just wait. That was pretty much, yeah.
Do you know when you have to wait till?
No, I think after your budget decisions, probably.
Thank you. And then I think the final questions are coming from Kevin.
Yeah, thank you, Chair. I suppose in my mind, as I'm mulling what you're saying over, we've had quite a few discussions at panel around the contracts that were being sorted out over last year, over things that we know sometimes we have no control over, such as funding, sadly. And then there are lots of things that hopefully we do have some control over. Could you just clarify again those things that you feel we do have control over that could have made both the process you've undergone and the process still in train better and more effective, so that even though we may be having to change things or sadly cut things, they can be done in the least harmful way?
Yes, I'll try. So I think I'm going to go to communication. Really does make a big difference. We're no different to the council or council officers in that we have to plan, and the more notice we have to plan, the more likely we can achieve a good outcome. Going right back to the drug treatment commissioning, it came out in a way that was a bit of a surprise. Normally, as the incumbent provider, especially one that's been incumbent for 26 years, there would have been a pre-conversation. I think because it was with HCRG, that didn't happen. But, yeah. I think, yes, procurement's procurement, but I still think there might have been another route, but that's been long discussed, so I won't go there. But, you do have the power, your officers have the power to hold your contractors to account. And I think given that there was very much a sort of we must work by the letter with procurement and they scored higher, and there was no interview process or anything else, it was quite a paper exercise, I would say. I would strongly suggest that you scrutinise and make sure that the promises offered by a national are delivered, because I don't think it just relates, I'm not making an accusation, but I am aware that there are a number of nationals get a contract and then don't necessarily deliver all that they say. And then with these more recent bids, as I say, we've gone through a big restructure in the last year. We're now trying to budget for next year. We're trying to do our strategy. Where do our fundraising efforts need to go? Where does my time and attention need to go? Do we recruit to this vacant post, or do we leave it empty because we don't want to recruit and then make somebody redundant? there's a billion, you know, do we need to look to rent out an office, or do we, there's lots of decisions because of the, I think, the scale of the sort of cuts. That cumulative thing just means we really do need to be trying to be ahead of the game. We always do try to be ahead of the game, but we're just, in this instance, we're just waiting to hear. And we're losing valuable staff as a result. And we have some really great staff, and it's a real shame.
Thank you.
Thank you for the questions, and thank you, Rosie, for your responses. I don't know if officers or a Cabinet member wanted to say anything at this point, particularly around procurement. I know in the Cabinet member's report, actually there's perhaps an indication that procurement processes may have changed. I don't know, just in the way that some of those have been, contracts have been awarded most recently. I don't know if, as I said, if you wanted to speak now, Alison.
I suppose what I can say is that the procurement process that Rosie's been referring to was a public health procurement process that took place some time ago, and the contract change took place a year ago. The processes that I'm referring to, I've referred to in my report, relate to procurement processes that have taken place in the past year and which were adult social care contracts. So that's different. I think the changes that Rosie's referring to, that she's been discussing with council officers, have been with housing officers, not social care officers. And I'm not quite sure where the scrutiny of housing takes place, if that takes place here or in another panel. I think sometimes it moves a bit between several.
Thank you. I've got a thought on this, but Rosie, you wanted to...
It's something I flagged a year ago. I've certainly flagged it a number of times. Housing, those contracts that were with HCRG that were sort of deemed to be housing support or housing were sort of removed from the block that, the adult social care block that Alison's referring to, and have been, we were told that would be dealt elsewhere. And that's where that went, but it didn't really seem to go anywhere. So there was no consultation as far as I'm concerned, and no clear process. That feels like it's gone into a back room somewhere.
Thank you. I'm going to suggest then that we have a report on the procurement processes and the impact that they have on adult social care, because obviously they are all interlinked. They don't exist in sort of isolation to other services. And I'm just going to quickly ask Becky Reynolds if she wanted to make any comment, particularly on the point Alison was making around this being a public health contract process, and whether or not my suggested report could also bring in any differences that public health might have to make in terms of their procurement processes. Hopefully that's not too complex a question.
Sure, thank you. Thank you, Chair. I'm Becky Reynolds, Director of Public Health and Prevention in the Council. Thank you, Rosie, for your comments as well. I think, as Councillor Bourne said, the particular public health procurement process was the re-procurement of our drug and alcohol services. It took place a couple of years ago now, and the new provider Turning Point has been delivering since April last year. We don't have any procurements coming up because at that time we undertook all of our large procurements. But yeah, so I guess it depends on the nature of any report coming on procurement. If it's around how the council or adult social care, what's within the portfolio of Councillor Bourne, is procured, then obviously public health in terms of principle would come in within that. Thank you.
Thank you. So I hope, Mark, you've made a note of my request for this report on procurement. And thank you, Becky, for your comments, particularly as I believe this is your last meeting. So very grateful as ever to have you here. Right, I think that's... Sorry, Rosie.
Sorry, I just wanted to put something right as well. So we have had confirmation that our supported housing is being funded at the same level, I think, next year. So that's the Jeremy is in one of those, so I didn't want anybody to have the assumption that that wasn't the case.
Thank you very much, Rosie. Thank you for your statement. Thank you for all the work that DHI does, and thank you for bringing these issues to this panel. Right, I believe that's the end of our public and councillor statements section. If you wish to leave having made a statement now, then that will be fine. Otherwise, you're more than welcome to stay for the rest of the meeting. Or you can leave during the meeting, I suppose, too. Right, we now move on to the next item, which is the Cabinet Member update. Thank you, Alison, for sharing that report with us. So is there anything you wanted to add to your report? Otherwise, I will open this up for questions from the panel.
Thank you. No, just to highlight a few things. In relation to community support contracts, which is the first item, they have now all been awarded. And there was actually very minimal change in terms of providers through this process. 6 of the new contracts started in January and the remaining 2 start in April. But the specifications, there was quite a bit of difference from the previous ones because a lot of time had elapsed from the original specifications, so there was a need to make some changes. In relation to Newton House, it's really nice to see relatives here again. And just to say that I'm really, really delighted that we've reached the situation we have, where we've made the decision to recommission that service for 5 years and potentially 7 years on a new contract. And I'd just like to thank you very much for the work that you did with our officers on helping us reach that conclusion. It was a really positive and constructive process. And it was a good example of a co-production, albeit from a rather shaky start. But I think we've got to a very good outcome in the end, so thank you for that. Apart from that, I don't think there's anything else I particularly want to highlight. There are several positive developments in the public health report, but rather than me going on about those, I'm probably happy to just take questions at this point if there are any questions or points of clarification. Thank you.
Thank you, Alison. I'm going to allow Liz to speak first.
Thank you very much, Chair. Firstly, what I'd like to say is it's really good news, Alison, about Newton House and the fact that its contract is secure. And I would like to point out that the issue was brought by the carers of the people that they care for to this scrutiny panel. And I do believe we had a very big part to play in actually getting the whole issue resolved. If I remind us that the parents and carers were given notice a month in advance that Newton House was going to close. So I think it's really good that that was all turned around. And I believe we do have 2 of the people here today from Newton House, so who also waged a really big campaign. But I do believe bringing it here very much helped us to resolve the issue, especially as the Director of Adult Social Services said she hadn't heard anything about it until it was actually brought to this panel. So the first question I'd like to ask is, what are the lessons that we've learned from this to make sure that it doesn't happen again? So I'd like Alison to respond to that, please.
Okay, I'll just clarify. I don't think Suzanne said that she wasn't aware of it until it came to panel. Neither Suzanne nor I were aware of the letter that went out to parents until we heard about it from parents. And that was clearly not the way that things should have been done. There was an error in the process, and we held our hands up at the time and acknowledged that and apologised for it and said that we would want to work collaboratively on a better solution, and that's what we've done. So I think the important thing is that we don't make any important decisions, certainly not decisions of that magnitude, but any decisions, I think, which are around changing the way that we provide services for people without involving the people who use those services in them. Now, that doesn't mean that we won't ever have to make difficult decisions, but we will be making those decisions in a fully informed way with the people who will be most affected by them. And they will hopefully understand why we're making the decision and will feel that whatever conclusion is reached is a reasonable one, even if it's not something that they would choose.
Thank you for that. But I would say that it was the publicity around the whole issue that actually brought about negotiations leading to the eventual change in outcomes for the carers. I apologise if I got it wrong about the Director of Adult Social Services, but we were told that she wasn't aware of what was actually happening. Perhaps that the letter had been sent out. Maybe she was not aware that a letter had been sent out saying that the home was going to close within a month. But anyway, that's by the by. Let's move on and just say well done, and it's really good to see that that's happened. So with the Chair's permission, I have two other very quick questions. One is about adult regulated services. The staff at Cleve House must be very disappointed to hear that they still require improvement. An awful lot of help and money has gone into improving Cleve House. So what exactly is needed for them to become good? If you'd like to respond to that, please.
Okay, I'm going to defer that to Claire, who is the head of those services.
Thank you very much. Claire Farragut leads on all regulated services. I did come into panel, didn't I, back in November with a full report of all the activity that we have done. Yes, we're disappointed. We were 1 percentage point off, of course. So those efforts will never cease. They will continue. We have an action plan that we are diligently working to, that we have done since before inspection, that carries us through. I have made a full commitment to coming back. I said March in the update. I believe it's actually April, okay? And I will come back in with the head of service, and we will give a full report on the progress that we're making. We're still making very good progress. We have an internal improvement group that comes together on a monthly basis and report to the director on a 2-monthly basis about our process. So I will give a full detailed briefing on those actions, if that's convenient to panel. And we have also an update with regards to Coombe Lee. We had our unannounced inspection of Coombe Lee. I am expecting to receive that draft report within the next week or two and move to publication. So with panel's approval, that will be a full update again in April to do the action plan for Cleve Court and update panel and the outcome of inspection for Coombe Lee.
That's a really good reply. Thank you very much, Claire.
No problem.
My last question is really to request a report, and the Good Food Local Benchmarking exercise is going to be published, and I thought it would be really good if we had a report on that in one of our later dates, and I think I've mentioned that to the Chair.
Would that be through Public Health, Becky?
Yes, we'd be absolutely delighted to. Perhaps if we can arrange a time outside, if I just check back with the relevant officers. It's a cross-council piece of work. The completion of it is being coordinated through Public Health, but it's cross-council because it's very much looking at a whole load of food systems, sustainability, the transport of food, food growing, as well as healthy eating. But yes, delighted to at an appropriate time. Thanks for the invitation.
Thank you. And I think that draws also in a thread that came through a different scrutiny panel as well around food growing too, doesn't it? Yes. Okay, so thank you, and very good suggestion, Liz. On my list now I've got Kevin and then Leslie. Kevin first.
Thank you, Chair. Yes, morning. First around community contracts, please. For a long time, there's been lots of strong messages around the importance of our voluntary sector in Bath and North East Somerset and the key role that they play for our services. So I'd like to understand a little bit more about how that is put into practice in terms of working with them, designing things that will support and enhance the work that we do locally, and the value of that local knowledge and experience that it seemed from the last statement we heard may be lost in certain areas now. And also around the contracts area, when is the next sort of contract round due? Now we've had these particular awards made, and have we made any savings? Are services less than what we had expected before? Have we had to drop things? Then there's a question around Newton House itself. Are there any hurdles left, do you see, between now and October, when hopefully this comes into continuation of services being provided? And how will the families be involved from this point onwards? Is there something now established, not only the co-production of what happened up to this point, but ongoing in that service? And on the Cleeve Court, and it's, you know, there has to be a cut-off point somewhere, I appreciate that, and it must be encouraging in one way that you've moved so far. But if you could pinpoint what you think is the area or the bit that hasn't quite made it yet, and where you're focusing the resources, would be really helpful. Do you want the Public Health Chair questions now, or shall we?
Perhaps we'll pause on the public health for now.
Okay, there were a lot of questions there, so I hope I've remembered them all. Firstly, in relation to the way we work with the voluntary sector, I mean, we do have a fantastic voluntary sector locally, with a lot of really, really good organisations that do excellent work. We work closely with them through 3SG, which is the umbrella organisation that coordinates the voluntary sector, and we've got a close working relationship with them. And on the recommissioning of these services, we worked very closely with 3SG and all the existing organisations to ensure that they were fully prepared for the recommissioning process. Now, obviously, there are rules that we have to adhere to, and we cannot be seen to be giving undue or any advantage to any provider over another, but we were ensuring that they were fully aware of the process and prepared for it. The other way in which I think we work very constructively with our voluntary sector providers and get them to provide the best support they can is through the Community Wellbeing Hub, which supports the voluntary sector to work together with statutory providers to ensure that the broad range of individuals' needs who are brought to the attention of the hub are met in a very coordinated way. So I think those are two positive ways that we work with our third sector providers. I suppose the other thing to say is, for a long time, while the third sector was came under Virgin Care, under the Virgin Care contract, that contract was flat cash and there was no uplift for those providers in that time. Under the new contracts, these new contracts will get an annual uplift along with other providers. So that's the way that we've recognised that we need to support our voluntary sector providers to enable them to deliver the work that we need them to do to support our residents. So that's that bit. The next contract round, now, I think these contracts are 5 plus 2 years, but...
So 4, yeah, we're looking at 4 years.
4 years.
For public health, yeah.
Thank you. No, yeah, for public health, but for the new ones, are they 5 plus 2? Yes, they are 5 plus 2, as I thought. So we shouldn't have another contracting round for a few more years for these, and obviously for public health, because they're a year ahead. It'll be a year sooner. In relation to further hurdles about Newton House, I very much hope, I'm confident that there shouldn't be further hurdles. As well as working with the families, we've also been working with the provider, so they are on board with the process. So I don't think we're going to be in a position where we're going to offer them a contract that they're not going to want to take, which I guess could be a potential hurdle, but I think we should be able to avoid that. And I think the relationships with the families are now well established, and the families will continue to be kept informed on any developments. I'm going to, yes, hand to Claire for the...
Thank you so much. With regards to Cleeve Court, if you asked me to pick one thing, that one thing would be around care planning. And when I come back in April, you'll see that the action plan centred for Cleeve Court, all roads lead back into the effectiveness of our care planning. We have a good care planning system and platform, but what we've done in that time is increase the level of staff confidence and training around using all elements of the new digital care plan for risk assessment and demonstrating how the rationale, how decisions have been made. So when I come back in the April period, that will give panel full oversight of the 3 major actions we've taken, but Kevin, they all relate to care planning.
Darryl.
Thank you, Chair. And just to add to Councillor Bourne's comments around the VCS, I've certainly been having discussions with 3SG recently, but also to say that 3SG and other VCS partners have a seat at the Health and Wellbeing Board and at the ICA. So it's a piece of work that we're doing with the ICB and around neighbourhood plans, integrated neighbourhood teams, and how we engage fully with the VCS sector.
Thank you. Shall I do the public health then?
Yes.
Thank you so much. So around public health, a couple of questions. First, around the dental supervised brushing programme. Can you say now that all 3 to 5-year-olds in the most deprived 20% are covered now through the nursery and reception places? And do all schools and nurseries take part in this? And how are health visitors, if at all, involved in this programme if there are children that maybe are not covered so far? And the second question is just around the active wellbeing Big Connect event. Trying to understand whether that's linked in any way to the Active Way programme and the evaluation that the UWE are undertaking. Does that come under that, and who's coordinating this event? And finally, not a question, but just a request for an update sometime, or the next whenever, please. There was a whole system framework for Be Wellbeing and a couple of pilot programmes set up around networks for community setting and an education setting, and where they've got to, and what's happening with those good things, please.
Thank you very much for those chairs and for those questions. So if I start at the end first, if I'm missing out, please do tell me. Yes, we're very happy for somebody from the team to come and give an update on the whole system framework for health improvement. So if councillors remember, that was the purpose of that was to bring together a number of existing health improvement strategies that we had at the time. We had one on healthy weight, one on tobacco control, one on physical activity, etc. And the whole plan of this was recognising that in order for people to live healthy lives, there's a lot of commonality between those two, whether it's in terms of behaviour and behaviour change, or whether it's in terms of access to green spaces, or how the council and how other partners can make it easier for people to live healthy lives. So it's a health improvement framework. It has a number of elements to it. So it links very much to the Big Active piece that you asked about, that's in the update report. So the event that was held at the university is part of Be Wellbeing, because under Be Wellbeing, the health improvement programme, there is an aspect of it, a strong work stream on it, around helping people to be more physically active. So that piece of work was very much an engagement piece of work, building on the physical activity, out-of-date physical activity strategy that we have, engaging with many partners, including the third sector, including businesses, the universities, council partners, the NHS, to look at how we can put in place an action plan that helps people be even more physically active, based on a needs assessment and based on CMO's recommendations of physical activity. So that's where that fits in terms of governance. In terms of the Active Way, the very specific piece of work, there would have been colleagues invited from the Active Way to that event because it's very much trying to take a whole systems approach, very much linking in with our highways, with existing programmes of work that also enable people to be more physically active. I'm very happy to bring a paper at a future point on Be Wellbeing because, as I say, it does have a number of elements. One element is around working with a particular community, which might be, we haven't yet identified that, it might well be Twerton, but that hasn't been identified and agreed yet. And so a lot of the work that's happening at the moment is very much linking in with existing pieces of work that involve community engagement, because it's very much around a system change. So very much linking with Pride in Place, with our neighbourhood health teams, and the development of the neighbourhood health plan to look at how we can complement and add to each other's work, which is all around trying to support neighbourhoods to be places where people can grow up and live and work in more healthy environments. Going back to your first question, which was around the supervised toothbrushing scheme. So yes, in theory, 3 to 5-year-olds are now covered. It's totally up to those particular settings as to whether they take part. And I think I've put a little bit in the update report about some settings do find it difficult to take part because it does involve time out in the setting every single day to carry out that supervised toothbrushing activity. But the provider, At Home Dental, who delivers that service on behalf of the council and will be on behalf of the ICB as well, has a very proactive and collaborative engagement with all of those settings, and it does absolutely what it can to help settings that find it difficult to take part and find solutions to delivering that scheme within the setting, sharing case studies, trying to find ways of tweaking the scheme to make it as easy as possible, because we're all committed to children and young people's oral health. Yes, the health visiting service are very much involved in it, very much aware of it, promote it in their visits. The work of the supervised toothbrushing scheme comes up in various partnership forums as well, at which health visiting sits, such as Best Start for Life. So it's a regular topic on various, also the Children and Young People subgroup to the Health and Wellbeing Board. Oral health is a part of that comes up periodically, because that group is all concerned with health and wellbeing of young people. So health visitors are key in the promotion of that, and as having their conversations with parents around supporting parents with their new babies around oral health as their babies grow into toddlerhood. But that's okay. Thank you.
Thank you, Becky. And thank you, Kevin. I think Leslie and then Paul.
Thank you for the report. I'd like to ask a cross-cutting question first of all, and then I've got some others, but also linking back to the statements that we had earlier on, because some important points have been raised. So I'm quite shocked that there's an issue around named social workers for people with very complex needs. And I won't ask the question now about who does actually get the named social workers, but I understand that in the children's services there's been an industrial ballot carried out in regard to social workers and pay being lower than in other local authorities. So how is that impacting on the service in ASC? And also, are we in danger of having a similar situation in adult social care? Thank you.
Anne, did you want to pick that up?
So on the issue of named social workers, I apologise to panel if I wasn't entirely clear. So when we are working alongside an individual, either for an assessment or a review or another part of our work that we would undertake, the person would have a named social worker allocated to them. However, if there's a person whose next contact with us would be perhaps their annual review, they wouldn't have a named social worker until that review took place, but they would have a point of contact with the team. So I apologise to panel if that wasn't entirely clear around that. Adult social care have been through our restructure, and our reshaping has been borne out in terms of our improvement plan. So that piece of work has been finished for us.
Leslie, you look like you want to come back on that.
Now, I would like to pick up some of the other points I've got, and thank you to the...
Sorry, Leslie, I think Darryl wants to come in. Sorry, I have all my eyes in all the right places.
In order to answer the question, can I just come back on the point about the dispute currently within Children's Services? Just wanted to acknowledge that there is a conversation going on that involves an ACAS process. It wouldn't be appropriate for me to comment in detail here. That's part of an ongoing process with the Director of Children's Services, the individuals concerned, and ACAS. That's not, I think it is fair to say that it's not specifically about pay in relation to other local authorities at all, but that's a matter that we need to just let it run its process for the time being.
Thank you, Darryl. Leslie.
Thank you. I'll move on then at this point. So, and thank you to the statements from the public earlier on, because that sort of anticipated some of the questions that already got written down. So with regards to the community support contracts, what safeguards are in place to ensure that smaller voluntary sector organisations are not disadvantaged by the new procurement flexibilities? With regards to Newton House, congratulations to the people there that have said persistently we need this service and didn't feel they were being engaged in that process of a change to a service. I think family power has worked well here. But what measurable quality standards will be introduced to ensure the new contract delivers improved outcomes for disabled adults and their carers? With regard to the child injury prevention, can we have a report that shows the data collected so we've got an opportunity to evaluate the impact of this model, and we need to think about how it could influence future strategies. And also on the active wellbeing and physical activity, there was a big Connect event. So how is the Council ensuring that the momentum from that is leading to tangible, measurable improvements in activity levels? Thank you.
And it may be that some of the question around procurement might be picked up in that report that we've asked for around how procurement works, particularly with regards to adult social care delivery. So Alison or Darryl, I don't know who wishes to go first. Alison.
Right, in relation to the safeguards for smaller organisations in commissioning processes, I may need to ask for a more detailed response from my Commissioner colleagues. But I know we were aware that because our third sector services have been part of the Virgin Care contract and hadn't really been subject to the usual commissioning cycle and management by the Council for some time, that some of them were less informed about commissioning processes than they perhaps were, and I think that's why we did the preparatory work in advance of this re-procurement process to ensure that the third sector organisations were fully aware of the processes. But I think if you want more detail on that, I would need to ask Natalia for something on that. And likewise, in relation to the detail of the Newton House contract, I think that would have to be answered by Natalia. But obviously, we will be wanting to ensure that that contract delivers the best possible services and outcomes that we can.
If I can perhaps comment on the child injury prevention, obviously that's a partnership initiative with Avon Fire and Rescue Service. So we're not in a position to be able to comment in more detail on that at the moment. We can get that information for you.
Thank you. I think that would be very welcomed. Thank you, Leslie, for your questions. Let's move on to a growing list. Paul Crossley.
Thank you very much. I'd like to refer to item 4, South West Good Food Local Benchmarking Process. This looks to me like a really exciting project and one that has a potential for a lot of good outcomes with all the communities in the southwest if it is applied properly. So I've got a lot of things I'd like to ask. First of all, I see completing on the 31st of January. I wonder if we could perhaps consider, through the Chair, bringing this as a major item for consideration before we finish our public position on all of this. For me, it's not just about benchmarking. What I would hope to see from this is that when we've got those benchmarks, that we as a council, if not necessarily all of the South West, actually put some goals and objectives for those benchmarks to how to improve it. So, for instance, one simple thing is that potatoes can be cooked into other forms than just chips deep fried. You know, you can mash them, you can do a whole series of things. So it's all about education and how diet health and cooking skills. And I think a lot of problems arise since we took cooking out of education. Yes, we can't just here say, let's bring cooking back into education, but what we can look is to see how we increase the ability for people to know better ways that they can cook. So I think this, I'm very excited about this report, but I wonder if we could have a more detailed paper on it before it goes public.
We have asked for a report on this, so perhaps that the detail that you asked for could be captured within that. Becky.
Yes, thank you. It is the first time that such a questionnaire has been completed by every local authority in the South West, so it will provide some really valuable information. One of the key ways in which the information from it will be used in Baines will be to inform our local food strategy, which is in development. So those two things come very closely together. So it's up to you, panel, whether you'd like two separate reports, but it might be that you want to bring the findings from the survey and then thinking through how it's going to be used when we've had that consideration and looking at how it's going to be informing our local food strategy. So perhaps at some point the local food strategy can also come at the same time.
I think that's a very, very sensible suggestion, Becky, on the way forward. So, Onkar and then Joanna.
Thank you, Chair. So on the Newton House, why is the direct award the best option compared with the open competition? And what happens if the demand for respite increase beyond the current capacity? That's my first question.
I think the direct award was decided to be the best mechanism because there wasn't actually any local competition for providing the service. It's a service that has got specifically adapted space for people with complex physical as well as learning disabilities. And there aren't that many homes in the community that are able to offer that. So I think that was part of the work that was done, looking at what the other options might be. And when it was clear that actually, you know, there wasn't going to be a big queue of other providers offering it up, it made no sense to go through a competitive procurement process when actually, you know, there was likely to be a single provider that could provide the services that had been identified as needed through the co-production process. Okay, and I've forgotten, what was the second part of the question?
Thank you.
Sorry.
And the second, what happens if the demand will increase? Do we have like a capacity?
Well, I think the officers have done a lot of modelling of what they think the demand is likely to be. Obviously, we've got people who we know who are already in children's services who will be coming up through transition, so that will be part of the process, that they will have looked at what demand is likely to be.
Thank you. And on child injury prevention, so how will the referrals into the new fire and rescue safety scheme works?
Yes, so thank you. So this is a scheme that the Public Health Directorate has commissioned for quite a few years, injury prevention scheme, and up to the point when HCRG delivered many of our contracts, it was delivered through HCRG. It was then something that was brought in-house when that large contract with HCRG ended. Many local authorities, public health teams over the years have stopped providing such a service because budget cuts have been so tight. in councils and in public health grants. We have managed to maintain it. It's a very small grant. It's a very small budget. It's about £5,000. And it was brought internally into the council, and one of our teams in the council was delivering it alongside a community equipment scheme for adult social care. That team had a lot of pressures on, and so weren't able to continue to deliver this child scheme. So we're so pleased with our partnership working with Avon Fire and Rescue Service that they're very willing to work in partnership with us to go and fit those gates. I appreciate I'm probably giving you a little bit more information than what you've asked for, but it's sometimes that context is useful. So they are very willing, when they visit families, to fit gates when they've had referrals. We have enough funding for about 70 families each year, so to fit 70 sets of stair gates each year. And so the referrals will come through health visitors and our specialised team within health visiting who particularly work on vulnerable families. So a lot of work has been done on the pathway to make sure that those vulnerable families who aren't able to buy their own or aren't able to fit their own are supported through this scheme to enable them to have safety gates. There is a clear pathway. I can send it on to you later if you like, but because the funding is limited, there are some quite strong criteria to make sure that it reaches those who need it and aren't able to fit safety gates themselves. Thank you.
Thank you. Sorry, I just lost my list for a moment. Michael, I think you're next on my list.
Thank you. This is a public health question. I was interested in the work that you were doing with nurseries and around dentistry and cleaning teeth, and I'm just wondering if there were particular parts of Baines where the take-up had been low. I know obviously looking at it, you're targeting particularly those areas in so high social deprivation, but I'm just wondering if there were areas and whether there's any role that ward councillors can play in trying to engage with some of those nurseries and care settings that could get involved with that. And also, my other sort of separately linked with that is there work being done with dentists as well in terms of engaging with them? Because I know that a lot of dentists are not taking NHS patients because they're all moving privately, and that must impact areas of so that because people on benefits, for example, are not going to be able to access dental services in the same way. So maintaining our children's teeth health is really important.
Yeah, thank you. Thank you for the question. And thank you for the offer of support as well through councillors, more councillors being able to perhaps work with those settings, whether it's primary schools or nurseries where uptake is poorer. I don't have the detail around particular areas, but I can certainly get that for you if that would be helpful. And as I say, thank you for that invitation. In terms of links with dentists to promote the supervised toothbrushing scheme, I'm not aware. I can ask the question as to whether or not dentists do promote that scheme when they are working with parents who have very young children.
We can ask the question and bring it back.
Okay. Right, are there any... Have I not called anybody who said that they wanted to speak? Oh, Joanna, sorry.
That's okay, thank you. I appreciate, Darryl Freeman, that you are unable to speak to us about the issue with UCAS that is ongoing at the moment. But it does seem to me as a councillor that, one, we've not been informed that there is that discussion going on in any shape or form, and that the pace, that the Being Our Best pay review was meant to improve things for officers across the council, and that now it would appear that social work managers are now on the same pay grade as practitioners, which is causing problems, and that there seems to be a problem with morale in the level of social workers at Baines, who it would appear are being paid less than many other local authorities. So I guess my question is, how is the morale of social workers impacting the work that they're doing in frontline services?
So again, I'm in the same position where I can't comment on a couple of notes. What I will do is I'll take the action, though, to feedback your comments to the head of HR and OD about how how, in more general terms, matters around industrial action or in relationship with the unions is communicated where appropriate with councillors. I don't know whether the Director of Children's Services wants to say anything in a moment, but from my experience in my contact with frontline workers, I've rarely come across a more motivated and committed and passionate group of people working with very vulnerable children and young people across Baines. It is the case that a small number of our colleagues are unhappy with their current terms and conditions, whether that's about morale or whether that's about their terms and conditions. But again, that's an ongoing process that I can't really comment on. I don't know whether Jean would want to say something just more generally about the commitment and morale of her teams.
But only if your microphone works. Can you use... Thank you.
Jean Kelly, Director of Children's Services and Education. This is something that has been going on since last year when the Being Our Best programme was undertaken. I think the majority of staff within children's benefited positively from the Being Our Best arrangements, social workers included. As Darryl says, there are a small group of colleagues in that management and senior practitioner grade who have expressed their unhappiness. We had an Ofsted inspection in the summer of last year, and there was a clear indication of the passion, the commitment, and the impact on children and families that passion and commitment had. I absolutely hear that there are some staff who are affected and are unhappy, but it isn't necessarily a panacea for all of the staff in the service who continue to act with considerable professionalism in relation to the service that they offer to children, young people and families in Bath and North East Somerset. And we're working hard with colleagues to find a solution or some solutions to the issues that they're raising.
Thank you, Jean. I think actually Liz has the last question.
I think it's quite important that we know when the outcomes are going to be, because this is affecting our social work teams. As you know, it looks like there is an inequality action here where some senior practitioners are paid the same as main grade that they are supervising. So I think it is important for us to know. So I would be grateful if amongst the officers here, if we could have some idea. It does need to be resolved, and it's never black and white, but it looks like quite a simple issue here. Thanks.
Thank you. I think we've got some nods. So Darryl and Jean have nodded, so hopefully. But could we have some idea of the date that we might hear?
Well, we've got a meeting in a month's time. Can we expect a response in a month's time on this issue?
Well, it might be a bit too late, Joanna, so that's why I'm asking for the date.
We have a meeting, I think, in 2 months. It's early March, I think, is the next meeting. We will, as I said, we're in a process at the moment that doesn't have an end date. It's an ongoing conversation. There is a ballot going on, which does have an end date. That's in 3 weeks' time, was it, best part? That doesn't necessarily mean it will go into one course of action or next. So we'll through the chair, we'll figure out the best way of communicating progress in the process that we're in.
Would it be appropriate to ask for an update at least by our next meeting in March?
Absolutely.
Okay, thank you. But obviously, if there's something substantial you can tell us before, that would be good to have. Thank you. And thank you for your commitment to that. Right, now, in a slight change to the changed agenda, I'm now going to bring the budget item next, which I hope is acceptable to the officers who I think were going to lead on the complaints report, but I think they're the same ones who might be involved in the budget as well. So hopefully that is acceptable to everybody, but I think it's also it's useful, I think, for our members of the public who are here, who I suspect are waiting to hear about this item, perhaps more than the complaints item. So, right. Alison, would you like... Sorry, Alison and Paul May, welcome. and also Darren, I think you're going to be leading on this. So obviously we've got the report before us. I think it'd be helpful just to hear anything additional to that, or anything that you would like us to pay particular attention to.
Thank you, Chair. So I'm Darryl Freeman. I'm the Executive Director for the People Services. The paper outlines the 2026-27 budget and council tax proposals, which go to Cabinet and Council in the coming weeks. The report and accompanying documents before you present the draft proposals that are relevant to this panel rather than the whole budget, so specifically around children's and adults. The current draft budget funding and savings requirement over the next 5 years is set out in the report and includes an initial view of the fair funding changes provided in the settlement that we received just before Christmas. Also contained in the report are a table and graph summarising the assumed movements in net budget requirement and core funding. An indicative budget forecast with details of cost pressures and assumptions is included, and that to deliver a balanced budget for 26-27, savings and income generation plans total 7.9, with an income and savings million, with income and savings defined of 32.05 million over the next 5 years. So this budget round has been extremely challenging, and as you'll see from those figures, it doesn't get any easier over the coming years. The Council, and most relevant to this panel, the Children's and Adult Services have a good track record of delivering proposed savings, and in relation to Children's and Adult Services, there are savings and income generation plans of £3.2 million. The proposals for savings and income generation for your particular attention are outlined in Annex 1, and these include a review of adult social care packages to ensure that people have the correct care package, ongoing efficient management of contracts for services and optimisation of children's commissioning resources, and the continuation of activity to support children's service family reunifications, including a step down from residential placements. Budget growth and additional pressures across all portfolios of 10.49 million have been added to ensure that the budget remains robust, and for the portfolios scrutinised by this panel, there is a budget growth covering demand, inflationary pressures and new funding requests of £9.9 million. Growth and pressures to bring to this panel's attention are outlined in Annex 2, and for information, Annex 2 also includes a growth bid for the community safety team, which is not referenced in the main report as they're not a part of either children's or adult services, but are relevant to this panel. As I said, you won't be surprised to hear that the budget setting round for this year has been tough, and the report clearly outlines how that will continue over the years to come. Both children's and adult services are demand-led services, and the teams are very focused on how we manage the best possible service going forward. And senior teams led by the directors of adults and children's services are committed to delivering high-quality, resilient and efficient services. Both have a track record of delivering these services and delivering savings in the year, and both will have achieved all of their identified savings in the present financial year. You'll see in the papers different approaches this year from children's and adult services. Adult services have put forward a number of very carefully considered savings proposals, where children's services have focused on significantly reducing the growth bid for the year ahead compared to previous years, and concentrating on building a more sustainable financial platform. The public budget consultation began on 12th of December and concludes later today, so obviously we're not able to factor in the information that's come out of that process just yet. You were asked to note and to discuss the proposals that impact on the Council's revenue budget for next year. I would ask the panel to keep in mind that I'm a poor substitute for Suzanne's experience and expertise today, and I'm grateful that two of our assistant directors are present to assist with responses to any questions that you may have, in addition to colleagues from Children's Services, the Finance team and the Inclusive Communities Manager. So before I hand back to you, Chair, I believe that Councillor Bourne would also like to say a few words to introduce this report.
Thank you. Yes, I mean, this administration has a track record of investing in adult social care services. The services also have a track record of making savings. This year, there is growth and demographic uplift of 4.6 million coming into adult social care. And the savings that are identified and that we're consulting on will produce a total of 2.7 million. So there is still an overall increase in the budget for next year within these proposals. As Darryl said, we've got a strong history of delivering on savings, and adult social care is the biggest proportion of the budget and any of the budget headings in the council, and as Darryl rightly said, it's a demand-led service, and we need to ensure that we are able to meet the demands of our local population. But we also do need to take our responsibilities very seriously in ensuring that we are delivering good value for money. And we can't just expect the funding to increase year on year without that assurance, because we are in difficult times financially as a country, and that's reflected in local government as much as it is anywhere else. So the measures that we've put forward, a lot of them are focused on us trying to intervene earlier to prevent deterioration and to reduce risk. And I am very supportive of those. And again, we have a track record in that area. By increasing the number of reviews that we do, we will be ensuring that people are getting the right level of service, because we have an up-to-date understanding of their needs rather than an understanding that was determined any number of years previously. So I think those annual reviews are really important, and I think we recognise that when you have an annual review done, for some people you need more services, so it doesn't guarantee that less services will be delivered as a result of an annual review, but for some people it will, and the modelling we've done suggests that we can make savings through that process and still manage to meet people's assessed needs under the Care Act. So I think that's all I want to say at this point, and I think, Paul, you may want to say a few words, and then we will, of course, be happy to take any questions.
Paul, could you introduce yourself as well? And it's very confusing having two Pauls sitting next to each other.
Thank you, Chair. Yes, I'm not going to say an awful lot. I think Darryl highlighted the fact that the pressures on children's services nationally have been enormous, and the new government, well, it's not new government anymore, but the government has stated that there's going to be some changes expected with the white paper. So the major issue has always been for children's services that the demand has outstripped our ability to be able to provide it, and therefore there's been overspending in terms of children's services. In this authority, the Liberal Democrat administration have supported children's services to the tune of about 20% in the last 2 years. So it's been a major commitment that the Council's made on children's services because that demand has been so high. And I feel humble in reporting that to the committee, because I think that is a major commitment that we've made to young people, the most vulnerable young people in our community. That means that Jean, who's the new... Sorry, I'm Paul May, I'm the Cabinet Member for Children's Services, Chair.
Eventually you'd say it.
Sorry. But it has meant that Jean has had to work very closely with the department to actually try and predict what the pressures are going to be, and then actually work out new ways of working to actually try and make sure that we're bringing the risk down for those growth figures. So it's been a major task in actually getting the figures down to a reasonable level, as Darryl has reported. From our point of view, that leaves a level of risk, because we can't control demand, but it is something that, in terms of the department working together to predict, and we found last year that in Q4 the growth was several million pounds just in one quarter, so the prediction becomes really, really difficult. But we've got new systems that we've got in there in terms of control. The controls that we carry out also are monitored on a 2-weekly basis with the Cabinet Member for Resources, so that's something that we keep right on top of it. But, and it is a big but, we are driven by the quality of services that we provide, and we should feel, I think, as a committee, proud of that, because I think it's something that we do feel really quite passionate about. So that's all I really wanted to say, Chair. Thank you.
Thank you very much, and thank you for finally introducing yourself as well, Paul. Okay, so who wants to start off any questions or any points they want to make? Liz, shall I turn to you?
Right, thank you for awarding me the task first. I just have a very few questions.
Sorry, can I just, that's a very good suggestion. Shall we do children's first and then we'll do adults after?
Absolutely, because I was going to actually talk about children first. And the first thing that, when I looked at the budget, was looking at this idea of reunifications. And it's a very good idea, you know, to actually try and get families back together again once the child has been in care and it's safe for the child to return. And I did remember last year asking questions about this because I didn't think we would achieve as many reunifications as possible, and therefore the budget, with the reduction in the amount of money spent on children in care, wouldn't actually fall as much as was predicted. And there's a prediction this year that this will save 390,000. So in a roundabout way, what I'm trying to say is, what happened last year? Did it not actually work out last year? Because when I read the background to this reunification budget cut, that it would be a saving, that it was going to include figures from last year. So I'm just wondering for enlightenment, are you confident this is going to happen? And what happened last year? Are we including some of the figures from last year? Thanks.
So Paul and then Jean, I think, wants to come in.
Yes, I'll refer to Jean because it's a technical question.
So we have achieved the identified savings that were plotted against reunifications for 25-26. In fact, we've already achieved those, so we're not at the end of the financial year, and actually we've overachieved on the amount that was agreed that we would save, and it's based on 10 children returning home from care. There's a careful plan that goes alongside that, so children and families need to be worked with to support that return home so that it lasts and has impact. So we overextended by, in fact we achieved about nearly £500,000 more than we thought we would, because these children were coming out of expensive residential children's homes, and the plan to return home was the right plan, and we carefully undertook that work. The 390,000 that's identified for the next financial year, again, is linked to particular children and working with those children whose care plan is to return home.
The reference to last year is not quite valid for this time round.
It's work that we carefully undertake. We've achieved that work, and the new savings are about continuing that work.
Okay, and I have one more question, Chair, if that's okay. It's kind of children and adults, but it's the transition to adult social care. So I'm not sure where exactly it fits, but apparently there's going to be a saving of 300,000. I'm just wondering how this is going to happen, because under the Adult Social Care Improvement Plan, there's going to be a dedicated transitions team to be recruited. So how do the two marry? If it's going to improve the transition to adult social care from young people going from being in children's social care to adult social care, how is this saving going to be brought about?
Thank you. So from an adult social care perspective, we do have a dedicated transitions team, and we start working with our young people from probably age 16 upwards. We already have some really good examples of where our young people coming through transition, and as they've reached 18, 19, they are moving out of residential type settings into their own tenancies. So we have a young gentleman at the moment who we're working with him around that, and that will achieve the savings based against the cost of the residential home, just base fees. by moving to a tenancy model. So his support is not changing, his one-to-one support is not changing. What we pay for accommodation is changing, because, as you know, the young people at 18 can have their own tenancy, where under 18s they can't. So it is a big change for those individuals to bring them back into that independence. So that's how we're achieving the savings.
Okay, but you're going to recruit a new team. You're saying that there is a team in place already.
So there is an adults team in place at the moment, a transitions team within adult social care. We've done lots of work around our options going forward for Jean and Suzanne to consider. But we do work with those young people from 16, even though we're an adults-based team.
Leslie, do you want to speak about adults? Oh, sorry, children's. My apologies. Did you want to speak about children's services?
Yes, thank you. Paul, you mentioned, first of all, the white paper. Can you just tell me which white paper you're referring to?
Right. Yes, the government's bringing out a white paper around children in care, and it's education for children. Darryl, do you want to? Because we're expecting it any day at the moment.
Yeah, there's probably two pieces of legislation that Councillor May is referring to. So one is the Education, Schools and Wellbeing Bill, which is currently with the Lords and should receive royal assent very soon, and that regards so wider implications around the relationship between the local authority and schools, for example, and strengthened safeguarding arrangements. It's also the legislative framework for the Families First partnership, and then there's a white paper on SEND provision and schools, or schools generally, but absolutely focused on SEND, which we are working on the assumption at the moment, and some indications that that will be published by the end of January. So if that happens, then we will quickly digest that and get some headlines, and we'll be in a position to report back to the next Children's Scrutiny Committee in March, at least on the headlines of that paper.
Thank you. So on the white paper on the special educational needs and disability in schools, there was a survey out which closed last week, I understand. Did Baines make comment on that? It only came out just before Christmas, and I did look at it, and I spent some time going through our papers, previous papers, and putting some information in it. But I just wonder if the council had responded to that as well.
Looking to my colleagues, I'm not aware I'm not clear exactly which survey we're referring to, because when the white paper comes out, that will be the basis of a wider consultation. So we would absolutely want to make sure we have a strong voice when the white paper comes out, which will be about reform of services for children with special educational needs and disabilities. The specific survey you're referring to, Councillor Mansell, I'm not sure of, so I can't really answer to say whether we responded or not.
Okay, so that's a bit of a concern, because I'm not sure who got that survey, and it seems quite important that was information was put forward on that. But obviously, there's still an opportunity to make comment on the white paper. Then that would be helpful.
Perhaps Leslie, you could send some link or title of that consultation, and then we can look at it properly.
I sent it to Laura Donnelly.
Okay, well, I think Chris will pick that up. Share the single microphone that works on that table.
Chris Milford, Director of Education for Baines. Yeah, we certainly will take a look at the link that you sent to Laura. We get many requests for surveys at the moment. It's a very busy time of year in SEND, and we make sure that we share all of our surveys with the Local Area Inclusion Partnership, the Parent Care Forum, and we always provide a full response, but I will check that individual one for you, Councillor Mansell.
Thank you. Leslie, did you have other questions?
Chair,
Okay.
can I just give a little bit more information about that? The white paper that's been referred to was originally expected last year, and it got put off because the government said they wanted to get better consultation out with communities. So
it's the white paper on the SEND reform.
On the SEND reform. in the government's budget for this coming year, there was quite clear reference to SEND and the fact that the SEND was going to be removed in terms of financial terms from local authorities in 27-28. And under those circumstances, we're waiting for the details of that in that white paper. But as this is an adults meeting, we didn't bring that today. And Darryl's quite right in making the commitment. We'll be back a full report if and when that white paper comes out, because it's going to be a major, major issue for many, many local authorities. Because by 27-28, the national deficit is going to be somewhere like a black hole of £9 billion. So it's a major issue for the government, as it is indeed for many, many local authorities.
Thank you, Paul, for the additional information there. Leslie, did you have other questions on children and not necessarily on the yet-to-be-seen SEND paper?
Thank you. Thank you for the clarification. On the children's services, so how will the additional SEND staffing investment be monitored to ensure it continues to reduce backlogs and improve compliance? Because I'm sure we're pleased to see any backlog is being reduced. And how do the funding proposals support shift towards prevention? And what metrics we've put into place to ensure that we can see what's happening there? Thank you.
Who wants to kick off on that?
I'll kick off so that Jean can come in and give the correct answer. But the Families First programme, the aim of that is that it's going to be concentrating on the front end and trying to make sure that less children come into care. But it's a major change in the way that local authorities are going to operate, and it's going to be changing the role of social workers. And the aim really is to try and make sure that the emphasis moves much more towards early intervention, working with families, rather than actually children coming into care, and not only the financial implications of that, but the implications for those young people coming into care is quite considerable. So there's discussions taking place with the Department for Education about how and when this can be implemented, and I think Jean can give you a bit more detail about that in response to that query from Councillor Manson.
Jean?
The prevention approach, exactly as Councillor May describes, requires all local authorities to look at how we better front-load our service intervention with families using a system called Family Help, as is described in the Family First reforms, to support children at a much earlier stage. In Baines, we're linking that with our Best Start in Life Family Hubs funding and agenda in order to make sure there is a really strong continuum between universal early help and then targeted early help support services. So as children and their parents need support, need some help and might need support, and as needs increase, we're ready at the earliest opportunity to support families in order to prevent the need for a statutory service. That's what a great deal of the reforms are predicated on. We still obviously have to provide a safeguarding service, so the multi-agency multi-agency child protection teams and the lead child protection practitioners are still a strong part of that agenda, because some children will need a statutory and more acute service. That won't change, but it's really repositioning how we undertake our work. We've been given some funding that supports the development for the implementation, and in Baines we will go live with our design on the 1st of July. We've already come to the Children's Committee to talk about that, and we'll update again in March with progress as indicated. So that's on that item. Then in relation to the additional funding for our SEND team to support the improved timeliness of the HCPs, that's been having an impact. We have a full-time team now who've had to undertake a good deal of training to be able to undertake the role that they have. That's all now completed, and we have seen a real upturn in timeliness. And I'm looking over at Chris Wilford, Director of Education, just to see if he can give us any current data on what that's looking like. But we expect it to continue to improve.
We do. The investment is very much about bringing down the caseload, the number of EHCPs that each practitioner holds, in order to provide a more responsive and a higher quality service to families, schools, parents, people who can contact the service area. We have been working through a backlog from that staff. They were all in place in September. We've got the timeliness down from what's taking roughly 30 weeks. We're now down to 26, and we have a plan to reach and improve that by August this year, so that we're well above national averages for that. We are also seeing some other benefits as well. So we started to see complaints reduced in the area of send, which is really, really positive, and fewer complaints coming to the council about not having to be able to reach the right people, not being able to get in touch. So we're seeing the quality of our service improve for that, which is really, really pleasing to see. And we aim to be well above national in terms of our timeliness by August this year. They're new staff, they're staff that have come into the service area, so it does take some time to train. Visibly as well, when you work near that team and service as well, you can see some real positivity in what they're doing. They're trying to provide a really quality service to parents and families, and they're value-based in what they're doing, and you can really, really see a change in that team, and pleased to work for the council as well.
Yes, if I can come back on that. I mean, that's fantastic news that things are shifting. That's really, really good. And I recognise that things don't change overnight, so that's, really important. It would be good to see some of this information going into a review of the Equality Impact Assessment. So at the moment, it's a bit light on actual impact and what's happening. It says very much this is what we're expecting to do, but then we don't know what's happened. So that would be really good to have that there. And the other thing is around staffing is, as Jean has just said about the prevention, which again is one of the Labour government's stated priorities. So do we have enough health visitors, for example, who are going to be able to work with families to ensure that we can get to that early prevention position? Thank you.
Absolutely, we recognise that there are many benefits which we think we can have around that, and we'll make a note of that for the Equality Impact Assessment going forward. We did commit to bringing back a paper in March on send and wider updates and information about how we work with parent carers, so we can look at that then. I'm not sure who's going to take the health.
So I've got Jean, Becky, and then finally Paul May. Becky.
Thank you, Councillor Mansell. Just to pick up in terms of the health visitor. So health visitors are commissioned through public health, through the public health grant. And so, yes, we are confident that we have, budgets are tight, as they always are. We are confident that we've got a skills and a quality workforce that's there. It's being delivered by HCRG, who have been our deliverer of health visitors and school nurses for a number of years. So we have very good and very strong relationships with them, both formally through contract monitoring and also informally outside of that. Budgets are tight, but they have good retention levels as well of their staff, and don't struggle particularly from staff vacancies either. Thank you.
Thank you. Paul May?
Yes, I think nationally it's understood that the education and healthcare plans and SEND is a broken system. And under those circumstances, we've been suffering as a local authority in dealing with the demand that we've had, which doubled over just a few years, without the necessarily resources to be able to deal with that demand. This team has been actually quite clearly working to bring down the backlog, and I think that is going to be really important. The important thing I think I just wanted to report, though, Chair, is that we are due and expecting an inspection of SEND, and we haven't had the telephone call today yet, but we're expecting it any time. And the commitment from the council, I think, is that if there are issues that we've got to deal with and they give us proper information about how we're dealing with these types of issues, we're open to scrutiny and we will be acting upon anything that's going to be there. But those big changes in the white paper are because the system is broken, and under those circumstances it's going to be a difficult issue, and I'm not being party political, it's going to be a difficult issue for the Labour government to actually come up with a solution. And if it was a simple solution, they would have come up with that solution a little while ago. So it is an issue that we're going to be, all of us, working together to help young people as the best way we can. Because a lot of requests come in every year, and we have to deal with those requests. And even though our volume of education and healthcare plans has increased enormously, that still leaves a number of parents who are really worried about their children. So it is an issue, I think, that we should all be worried about in terms of education and healthcare of children.
Thank you. And actually just picking up on a sort of maybe a implied point that Leslie made, perhaps in our future reports, if a savings has been asked for, we could have some sort of idea of, through some sort of tracking element within that report about what the consequences of that have been. So we've got more of an ongoing picture rather than waiting until each time we're discussing the budget.
Chair, can I just make the point that Councillor Elliott reports on a regular basis through to the Cabinet about tracking of finance and expenditure, and this, I'm not certain whether this is the right place to be bringing that back on a regular basis, because it is something that is dealt with elsewhere within the Council. We're more than prepared to be accountable. That's not the point I'm trying to make, but the monitoring of expenditure is carried out on a regular basis, and I gave a commitment at the last meeting of the children's section that we would bring along statistics along in terms of the performance, and we can add to that performance how we're doing against the finances. So I'll be picking that up, I think, probably in my reports I do on a regular basis back to this committee.
I'm sensing some pushback on my request there, Paul, so maybe we'll have a discussion outside of this meeting on this.
I suppose what I'm trying to say, Chair, is it is a part of what we do, but it is an important part is about the quality of the services that we're providing. So there's got to be a balance there moving forward. But in terms of the Council, there is accountability by Councillor Elliott to the Cabinet and thereby through the normal processes of scrutiny from is it the Corporate Committee, Darryl, that looks at the budget? So I'll pick it up in my reports, Chair, just to reassure you.
See that you do. Leslie.
So if I try to be brief here. So thank you for that, and thank you, Chris, for reminding us we're going to get this report in March. But we've looked at these figures before on the AHCPs. We know we're not doing them within the prescribed legal time frame, and we know that lots of people are not actually getting them when they should be. I don't quite know what the figures are, or if I've had them, I can't remember what they are. However, I do have people in the ward that are ringing me up saying, in one case certainly, they've been waiting nearly 2 years for an assessment for a child that's autistic, they think, so they're not getting the right support in schools, and it's the same old, around the treadmill of having to fight and fight and fight and still not getting anywhere. So it'd be really good to see something that's not just the figures, but the actual actions. And I know that we are doing work within Baines to try and look at different ways of supporting people that do need these services. And also, we did hear at the last meeting, I know you weren't here, Paul, but we did hear that the government has already committed, is it 3 million across the country on SEND, but there's more money coming through as well. There's another 700 million, I think it is, around SEND, looking at the process and looking at improving that. So hopefully Baines will be picking up on getting something out of that as well. Bearing in mind we are quite a small authority, but making sure that we're getting some of that money and putting it into the right places. Thank you.
Can I just clarify, are you talking about the money that we heard, I think it was Councillor Rigby, told us about that was being, we understood, allocated to 2 schools on the Culver Hay site? Okay. And there's more. Paul, I didn't know if you wanted to respond or if Darryl wanted to respond to that.
Certainly happy to provide more information. I'm just mindful we've gone into an area which isn't the topic of
Yes.
the paper, and obviously this is the adult scrutiny, so we haven't come prepared with some of the information for that particular line of questioning.
Okay, thank you. Okay, so we're now going to move on. I think, Joanna, you had some questions, I hope, on Children's Services?
Yes, thank you. Can you explain to me, please, in Children's Services 24-25, they spent 52.59 million. In 25-26, the budget was 40
Sorry,
million.
Joanna, could you speak up a tiny bit? More into the microphone.
Okay, I'll start again. Children's Services, in terms of their budget, 24-25, spent 52.59 million. In 25-26, the budget was 40 million, and they spent 46 million. So I'm confused where this 6 million disappeared to, and where did it get put? Because I can't imagine we completely reduced our costs by 12 million in total as well. So in the overall papers over the last few years, that's what's in them in terms of finances and budgets. So I'm going forward, it's hard to know where we're going forward when you look back and it doesn't make sense. If that makes
It does. I'm mindful that myself and Jean both joined fairly recently. I believe the £6 million that you're referring to is because it was moved across for homeschool transport. Looking to your finance colleagues. Yeah. So in case you couldn't hear, so in 24-25, homeschool transport appeared under children's, where it appears under a different budget line now.
Is there any way then in the budgets that movement can be identified more obviously? Because when you go back and look at the papers, it doesn't make sense. I think that would be a fairer way of sharing that reduction in cost, because the cost still is there, just be moved somewhere else. Okay, thank you. I'm still carrying on. It's really interesting to hear about all the reforms that you're making in terms of the front loading and family help. But what if demand does not reduce as assumed, or where that does not happen? How do you put in the financial and the human costs for that? Because there might be issues where you can't, things go wrong in that family setting, and you have to put children back into different types of care. How are we going to cost for that? And what does that look like?
So the budget is set on the basis of the demand that we have now. And we work really hard in Baines already to support children to stay at home wherever possible. So the initiatives that we have in place, we want to develop. So our Educare service, fostering families where we use a fostering model within family homes. And that's at a more acute level, with a further development of family help. So really thinking about interventions that support children and their parents much, much earlier. The national evidence base is that we will see a reduction in the number of children that require our support. But you're right, children will still need support. There will be a proportion of the population of children who are at risk, or either from within or outside the home, and they need our support and protection, and sometimes our care. We've held our numbers of children in care fairly stable over a number of years. I would expect to see that reduce, and I think that we will monitor that very closely. I think the other thing that we need to manage in parallel with that, though, is placement sufficiency. So where children live if they need to come into our care. Because we've rehearsed this many times in children's scrutiny, that it is the increasing costs of children's residential placements that causes us the most significant pressure on our budget. And if we, the work that we are undertaking, and it will take time for us to see the fruition of this, to increase our in-house foster carer resource, to think about in-house residential provision. It's something that we are looking at and developing plans for. We're already well on the way in terms of Charlton House for a particular group of children with additional needs. It's those two things in parallel that need to work well in order for us to really turn the curve on the pressure, the financial pressure that children's services result in for this council. And actually, I could be sitting in any local authority and I'd be saying exactly the same thing to you. So it's not just having one plan. You need a number of plans to manage this.
Okay, all right. My other question, I've got two more questions, maybe three.
Sorry, Paul,
what are our legal costs in terms of the budget for children's services? Because we're hearing that there is children not being supported in terms of their SEND applications and challenging that. So what kind of budget do we have in place for that? It's not quite clear.
Well, so the budget for legal sits under legal rather than under children's services. So I don't have that detail to hand right now, but we'll send that to you separately if that's okay as a written response.
Thank you. I think that would be useful to know what kind of costs we're having in that service area, please. One of the things that's come out from the other conversations today is about holding officers' contracts to account. And it's not clear to me. We seem to have all kinds of contracts within this department. How are we holding them to account when the detail isn't delivered? Because that costs us.
So in relation to contract management in children's and adult services, we have a joint commissioning hub and well-established commissioning arrangements and commissioning framework. So I'm proud of the fact that Suzanne would be if she sat here today, of the robust processes that exist. We'll probably come on to it in a later question in a minute. There are some savings against contract management for adult services. There are also savings against contract management under resources. So I'm sure that will come up later on when we move from children's to adults.
And then my final question is about technology. Seems to be, and I would imagine this is both for adult and children's care, that it seems to be seen as a cost saving and as a lever, but we don't seem to have any defined or detailed of what that technology is, and or that's how what the discussion of this we don't seem to have any discussion about what that technology is to enable care reductions. I'm assuming it's AI, but we're assuming that the technology is being treated as a neutral efficiency rather than something that actively shapes decisions in care settings. So what discussions have we had on data governing, safeguarding and accountability around this technology-enabled care?
So the use of technology currently isn't necessarily about AI. For example, it's a tool. One of the examples I'm thinking of is a tool that enables colleagues in both children's and adult services to undertake a visit, for example, to families and very quickly and easily translate their notes from that visit into our case recording system. That reduces the amount of time that worker would then spend on, for example, just sitting at a desk inputting information.
Can I challenge you on that? I just know from a conversation I have had with a relative who works in social services elsewhere in the country, she too has had training on that. And she has said to me, it's very good if you use it, but you also have to review it and go back to it and do proper work to it. And that lots of people don't. And therefore, the notes that they do provide and does get sent to her are not of use. So we're expecting, this is AI technology to provide us with something, but we don't have a governance over how that is used. And what I am asking is, what's the governance in place for that?
So, yeah, and I did say it reduces the time. So absolutely, it's always the professional responsibility of the social worker to check any notes that go into the system. I know Anne wants to come in on the magic notes point itself, but I just wanted to go back to the original premise that was made as well, that it's about delivering savings. Actually, in fact, the approach that's been used across children's and adults in relation to tools is primarily around improving the quality of practice and the service for service users. And then almost secondary to that, there's efficiencies around savings on some posts as well. And I know you wanted to come in on the AI governance element.
Yeah, it is on the AI governance, thank you. So we are using a number of AI tools. Social workers are, but other parts of the council are as well. From a governance perspective and a consent perspective, we have documents in place and policy in place around consent from individuals to actually have recordings and use AI in those meetings. From a safeguarding perspective, that's been through the BAINS Community Safety and Safeguarding Partnership, which includes the police as well, and they have signed off that approach. So everybody has, we have to seek consent, and people can say no to us recording those meetings and using those notes, which self-populates. And you're absolutely right. A social worker or whoever's doing that assessment does need to read and review those, and that does need to get sent to the individual. But that's only one part of how we're using that, as we've said.
Okay, right. So Kevin, you're the last person to speak on, actually before me, on children's services. Could you, if possible, make your comments succinct?
I will do my best, Chair. Just a general point to start with, around the principles quoted on the budget paper. It would be nice, because often it was said at this committee and other speakers contributing that invest to save is always a principle, but it never actually appears in the principles. So the questions around children's services is there didn't appear to be anything around either safety valve work or the recent information around the new schools funding, maybe for Greenway and Sulis AP and things, and even Charlton House residential possibilities, and whether they were going to be considered under savings, or whether that's something that might be put in later. And also whether there was anything around complex needs, and again the point that was raised earlier on about negotiating with health about budgets and how that might be done to review budgets around complex needs. And finally, Families First programme, we were asked, I thought we were told that there probably wasn't enough funding to actually do what needed to be done, but I didn't see anything mentioned about particularly Families First programme putting into the budget here.
I'll start, and then I'll look to colleagues to join as well. So safety valve, safety valve isn't part of this budget. It's a separate budget line. The way that safety valve has been set up, that transaction is dealt with separately, and we come to scrutiny on a regular basis to update on that. We're still in a process of discussion with the DFE around the resumption of our payments for safety valve, but that's why that isn't in this budget paper. It's a separate matter. Charlton House, in relation to savings that might be achieved through Charlton House coming online, it's not expected to come online operationally until late 2027, so from September at the earliest 2027. Therefore, we wouldn't expect to see savings from that resource coming online until likely 2028-29. In relation, sorry, and your question around working with the ICB.
Yes, whether there was any savings were mentioned around, yes, review of complex.
Yeah, so again, certainly as a development from the situation, say, a year ago, there's a well-established process now and a regular meeting and a formula that's followed between our Children's Services colleagues and our colleagues in the ICB, which looks at funding for complex care packages. And whilst I haven't got the figure in my head right now, we've seen a significant increase this year on the contribution from health into those complex care packages. And again, there's an agreed formula between the two, so that we feel is commensurate of the diagnosis and need identified at the time.
Thank you. And I think Kevin managed to steal my questions. So that's really quite neat. Jean.
Can I respond to the Families First issue? I think since the last time we've discussed this, we have now had confirmation of 3 years of funding that relates to Family First. I don't have the figures in my head, but I can share that information with colleagues if that's helpful. So that supports some of those changes locally and how we are going to implement and embed over the next 3 years.
Paul, and then I want to make a very quick statement, and then we'll move on to the adults part.
Thank you, Chair. Can I just go back to the query by Councillor Wright around home-to-school transport? It's something I've been discussing with Darryl because there's two elements to home-to-school transport. One is the children, and the other is the transport. And I think it's a perfectly valid query, and I think we'll be bringing something back because it went to another committee and we didn't have the opportunity to scrutinise it here. So I think we will try and pick up that general point. And just the other point is, that in terms of this exercise this afternoon, there is a statutory override in terms of SEND expenditure, and that is therefore not on the council tax budgets, but we have been reporting back on a regular basis about the deficits that have been on SEND in this authority, and we'll continue to be reporting that back in the normal way through my reports to this committee. So I think we just have to be careful. This exercise today is around the council tax rather than the SEND issue. Thank you, Chair. Sorry to interrupt.
That's okay. So my very quick comment I want to make is not to do with that. It's actually because I understand Claire and Anne need to be out of here by 12:30. So what I was going to say is we would put the complaints report and the improvement plan onto our next adults agenda, and that way we can focus without overly rushing on the next part, which is obviously the adults part of the budget. If that's okay with officers. Okay, thank you, and my apologies for making that change. Right, any questions then on adults? Obviously, if you've already asked the question within the children's context, I think everyone would be grateful if you didn't re-ask it at this point if it's been answered sufficiently. So any questions on adults budget? Liz?
Thank you again, Chair. My questions really revolve around what savings are going to be made and then what commitments have been made, and it's trying to match up the two. So firstly, it was increase the number of reviews to ensure people have the correct care package. That's really good. A review has to happen under the Care Act 2014, and it's the local authority's duty to review these care packages. But it said savings can be met through care and support available universally. So many of these people who appear to be getting an individual care package will be signposted to look for care and support which is available universally on various portals. So my second question is very similar as well. It's using the least restrictive passages. there's going to be a new service for people with learning and physical disabilities to develop short-term pathways. And the approach to develop these short-term pathways will be to maximise independence, and to me, it looks like we are reducing support. So we're saying these sort of packages are going to be in place, but we are reducing support. We're saying it can be available universally, and we're going to develop short-term pathways so that we enable help to be given and then possibly withdrawn. So I'm just trying to see how the two can be married up.
Thank you. You're right that they are linked. I think it's right to recognise that for some individuals. So although we've pushed back the improvement report, as you can see, we are only reviewing 74% of individuals each year, and 100% of individuals should have an annual review to ensure that we understand whether the outcomes that they wanted to achieve have been met, and we understand whether the care is still needed. So we do want to increase that number. The enablement part of that does come into play when we think about, we have a re-ablement service, so if you have something happen to you, you can get re-enabled. What we want to do is start to think, and Councillor who made the point about things like cooking skills or travel training or all of these other things where people haven't necessarily been given the opportunity to develop those skills, and then we'd look at whether they still needed the support. For adult social care, we do absolutely have a duty to meet eligible needs. There's lots of ways in which we can meet those eligible needs. We often provide advice, information, signposting to meet eligible needs now, and ensure that that happens. So it is a combination of those elements to see whether that care and support is still required following a review.
I think it would be quite useful if, as the Chair suggested, that we look at these cuts and see if we can see what the consequences have been of these cuts in future meetings, because you've answered it very thoroughly and very clearly, but I'm not sure I'm convinced that proper care packages are going to be available. And we heard Mr. and Mrs. Carter talk to us about their care package and how worried they are that there's going to be a reduction. So I think it's important to bear this in mind when we're looking at the cuts that are taking place. But thank you for your reply. I would like to ask a question on resources that you mentioned, but I will be asking that later on with the Chair's permission. You mentioned resources a little while ago, and apparently there's a bit of vagueness about the top 25 contract savings, and we can assume, I'm sure, that some of these are going to affect adult social care, children's social care. So I wonder, could you expand on that, please?
Yeah, so that particular saving obviously will go to another scrutiny panel in terms of the detail, but a long list of rather large contracts has been circulated amongst the director group. As a group of directors in this forum, so children's, adults and public health, we've absolutely contributed to that conversation. We've looked at that list. We've been very clear where we believe there might be savings achievable. So, for example, much of the public health commissioning contracts are public health grants. They're ring-fenced. You can't really touch those at all. We also know, we're very clear about the savings that we've put forward and proposed for adult services. So we've been very clear with our resources colleagues. We can't double count and count those contracts in as well. So we're currently working through that list. Our resource colleagues will be able to provide more detail of which contracts specifically they're looking at in another scrutiny panel. But we've been very clear as a group of directors and officers that which of our contracts might be available and open to efficiencies.
Thank you. So it will come under the resources panel. Thank you.
Sorry, can I just clarify, is that will that information be available at the joint meeting or the meeting that the chairs of the other scrutiny panels attend? Or is it a later meeting?
But if it's to the Corporate Policy Development and Scrutiny Panel, I think is the paper that's going there, but I'd have to thank my colleagues nodding to me, so I believe it's going to that panel.
Kerry says that it would be that meeting, which we're invited to as the chairs of the other scrutiny panels, so thank you. Okay, on my list I have Joanna and
thank you. In your medium-term financial strategy, you say that I think it's 19.5 million has been mentioned towards demographic and contract inflation pressures within the adult social care over the next 5 years. Do you want to explain a bit more about the demographic costs and where they're coming from and why we're to expect them?
So again, I'll point to my colleagues in a moment to add some detail, but say it's 4.6 million. You're right in terms of the 5 years, it's 4.6 million in the next year, and most of that demographics is modelling around an ageing population and contract inflation.
If we know we've got to model for an older population, I'm just wondering what that might also mean in terms of what services that we should have within that. So can you give us some more information here?
So I'll point to my colleagues for more information, but generally that's contained within the commissioning framework in terms of the contracts we've got. So we take a longer term view on contracts, but I'm sure Anne or Claire will be able to contribute.
Thank you. So yes, on the contracts, and there's already been a discussion, obviously there is an inflationary ask from our providers as costs continue to go up in national insurance and all the other costs that come with those inflationary updates. In terms of our demographics, that has been modelled over what we've seen for the past 2 to 3 years. So we have an increasing number of young people with complex needs who are being referred through transitioning to adult services. I think we all know and all recognise that it's a very good thing that our young people are surviving into adulthood, but that does mean a number of complex young people coming through to the service. We do have an increase in an older population in our area, and we do see quite a number of people in their 80s and 90s coming to us for the first time ever in adult social care, so that's also been modelled as well, and some of the other things in the budget proposals, such as the falls prevention, the increase in reablement also look to reflect that as well.
Thank you. And again, looking at issues that come up, like with SEN, but in adult social care, there must be legal costs, and again, it's not identified in any papers. Can we have more details of what that is, so that then we, at least as a scrutiny committee, can see what those issues are coming up, so we can challenge that? And I do think that there should be more information about legal issues generally.
Certainly we'll provide that information alongside the children's information that you requested earlier on.
And I assume that will all go to the corporate PDS as well, wouldn't it? Naturally.
It would, if there's I don't recall from the top of my head whether there's a growth or a savings bit attached to them, so there may not be specifically in those papers, but I'll get that information for you.
Thank you. Okay, Leslie and then Kevin.
Thank you, Chair. So which of the proposed savings carry the highest delivery risk, and what contingency plans are in place if they don't materialise? Also, the savings rely heavily on increasing the number of reviews. So how will the Council ensure these reviews remain person-centred and not financially driven?
I think in my conversations with the Director and her team, there's not necessarily one savings proposal that stands out as a different risk to all the others. I think, reflecting fairly the conversations I've had with them and with the Cabinet member, and as I said in my introduction to this item, this has been a really challenging budget round, and I think the team are understandably take very seriously the pressure on the service to deliver. They've got a good track record. They're absolutely committed to delivering on further improvement against CQC, but I think they would say that, actually, as year on year, this gets more difficult and more challenging and takes a considerable amount of resource and energy. So no one of the proposals stands out as more risky than others. I think if I was reflecting fairly the director's comments, this is a tough year. So I think she feels more nervous this year, perhaps, about the implications of the savings proposals. That said, in the conversations we've had, she feels very confident with her team that they'll be able to deliver on those, but it won't be without its challenges. I think, Anne, do you want to come back on the other point?
I'll come back on the reviews and person-centred approaches. And we've done a lot of work with our staff in terms of making sure that they focus on individuals' outcomes, on what people want to achieve, but also what people have achieved. And that's a really positive thing for them. So we have a duty to do that with individuals. We have a duty to co-produce that review with individuals where we may have a difference of opinion around how needs can be met. We have a process for that which may sometimes lead into complaints. We hope not. So that's how we'll keep our focus on making sure that those reviews are person-centred.
Thank you. Kevin, I think you might be my last speaker. No, you're not. David's going to be the last person.
A very quick question, really, and was just interested to understand if there were any elements of the budget that were discretionary, or whether they are all to do with statutory requirements now.
To my knowledge, I'm looking across to my colleagues, to my knowledge, it's all about Care Act needs and statutory requirements. It's gone are the days, primarily for children and adults, when you can deliver services that are discretionary. So looking to my colleagues, I'm getting nods, but I'm pretty sure it's all statutory work.
Sorry, I'll come back in. It is statutory requirements. So prevention, from an adult social care perspective, is also a statutory, as much of a statutory requirement as is providing advice, information, providing actual personal care to individuals. So yes, the Care Act changed that kind of discretionary element. There are some things where we talks about we could choose to do things, and that's where some of the enablement and the falls prevention elements come in as well, is in terms of trying to support people who aren't necessarily coming to us for care and trying to prevent that people coming into our services.
Thank you. David, you can have the last word on this.
Thank you, Chair. Can I just thank Cabinet members and the officers for their work? Yeah? Hard job. Thank you.
Very good, and I think we all support the sentiment there. Thank you, David. So thank you. As David says, I think it is, and as I think Cabinet members has also said, this is obviously, it's a hard budget. We're in very difficult times, but we do appreciate your ability to answer some of our more challenging questions as we move in to, I think each year it gets harder and harder, doesn't it? So thank you. Now we are going to move, finally, I think Lucy is thinking, to the ICB report. And thank you, Lucy, for attending. Will you be our sort of permanent person on this?
I'm currently holding the fort.
Thank you. Okay, we will try and bear that in mind when we ask our questions of you. Is there anything you want to add to the report as it is before us, or would you just like some questions?
Thank you, Chair. I just wanted to add at the beginning, there is a lot of detail in the report, but just an update on the ICB restructure. So as we move to our new cluster arrangements, we're currently going through that restructure process and currently in the process of looking at voluntary redundancy applications. I am able to confirm to the committee today that the new structure will include a dedicated place executive director for Baines locality, and I will bring further updates when I get that information, Chair. The other two bits I just wanted to point out are, as predicted, it's been a very busy and continues to be a very busy winter for the NHS. In the report you will see we have put in some additional things into the Baines locality to help make sure that we're supporting people and helping that urgent care flow. So we have opened 20 additional beds at St Martin's Hospital, on Ward 4. Those beds opened on time on the 29th of December, and to date we've had 64 people through those beds with an average length of stay of 72 hours. So that's really supported the acute hospital in terms of the Royal United, making sure they've got capacity. But equally and perhaps more important, it makes sure that we are taking people out of the acute hospital environment on their journey home by putting them into the community hospital bed base. The other thing we have done in Baines is we have again commissioned this winter acute respiratory illness hubs for children. We have also added on to that sessions for adults as well. 242 children have been seen in those hubs since Baines, since they started at the end of November, and that provides for both adults and children local community support to prevent avoidable attendances and admissions to hospital. In terms of the update, those are the key things I wanted to draw out today. Thank you, Chair.
Thank you very much, Lucy. Paul, and then Joanna, and then David. And then, yes.
I thought I'd asked this question last time, but maybe I didn't, so I'll ask it this time, definitely. The thing that I have a question about is that among the public, there's a 60% approximately take-up on the vaccine, but among the staff, there's a 46.5% take-up. So really, what I would want to know and ask about, because there's quite a strong anti-vaxxer lobby in our area, have you asked the staff why there is such a significantly lower take-up amongst staff than there is amongst the public? And if you really want to vaccinate everyone, what are you doing to encourage staff to get to nearer the public level of vaccination? Or is the anti-vaxxer question that we keep getting, has that got some time in it or some movement in it? Because, you know, Dave, I'm sure, will tell me that the anti-vaxxers are wrong.
Thank you for your question. So the report does contain an update that the vaccination uptake at the RUH, for example, has increased to 61%, which is in line with the national average. So there has been more work done by our healthcare providers to promote vaccination. You are correct. The committee has previously asked questions around staff groups. We do not hold that information, which is why we're unable to share it. But I'm very happy to go back to the acute providers to ask the specific question. But just like to reassure the committee that work is continuing on not only promoting the benefits of vaccinations, but also improving access. So, for example, taking the vaccinations to staff to make it easier for them to obtain it.
Thank you, Lucy. I've completely forgotten who was on my list, but I'll just work around the room. Joanna.
Hi, thank you for your report. I'm actually bringing up a question that I brought up the last few times to Laura, which was on abortion and contraception data. There's still nothing here, and in fact, it's now a news item that we have some of the highest abortion levels ever in this country going on. Can we have more information on this at the next report, please? Do you have anything that notes passed on to you on this?
So my apologies for the delay in bringing that information to the committee. I was unable to obtain it for this meeting, but I will commit to bringing it to the next one. Those services are currently being overseen by our maternity team. I've asked them for the information, and I will ensure it's added to the report for the next committee meeting.
I almost logged myself out then. Michael, and then... David, and then Onkar.
Thank you, Chair. With respect to mobile dental clinics, you've been looking at a draft procurement timetable from October. I'm kind of curious about what work has been done or will be done in the rural areas, and in my ward, including the Chew Valley. What kind of info are you looking to obtain or have obtained, and how have you got it, really? I'm just concerned that the rural areas and my ward might just be left as a bit more of a desert.
Thank you for your question. So the idea around the mobile dental clinics are exactly about trying to provide access for those areas that find it harder to access dentistry, which we know is a broad community issue. The update in the report today is that latest update provided by the dentistry commissioning team. I'm very happy to go back to them to ask a specific question, but as you can see from my update, they're just at the point where they're starting to look at procurement, which then will limit what we're able to say. But I think it's reasonable for me to go back and just assure myself and then assure you as a committee that those rural areas are included as part of that piece of work.
Thank you. Yeah, of course, I'm worried that you're going to procure, or they are going to procurement. So, you know, it'd be nice to know what information they are procuring on, because is it adequate?
I can ask those questions.
Thank you, Lucy. Onkar and then Liz.
Thank you, Chair. Thank you for the report. So, just a question about the Kingfisher Mental Health Inpatient Unit. So the report, unless I'm missing something, but a report says the construction progress, the milestones achieved and expected opening later 2026, but there is no information on staffing, operating model, on how this unit will reduce out of area placement or inpatient pressure once it's open. So it's really hard to assess impact without knowing workforce readiness, referral pathway or expected outcomes.
Thank you for your question. We have previously updated the committee on the espoused outcomes and impact of the new unit. Happy to bring that back again just to update on the information. In terms of workforce readiness, AWP, who are our provider, have done a really good job at recruitment. So all of the posts are now recruited to, including peer support workers to work in the unit. So where there are really nationally hard to recruit posts, such as consultant psychiatrists in this space, all of those posts have now been recruited to. The inpatient unit, as it alludes to in my report, also includes an outreach dedicated team. All of those outreach team are in post and are currently working. So the espoused outcome of the new unit is that local people, rather than going out of area for that type of care, will be able to receive that care in Bristol. Whilst that's not in Baines, it's much closer to where, unfortunately, people currently have to travel. But I'm very happy to bring back more detail on the outcomes and outputs of the new model.
Thank you. I think that would be appreciated. Yeah? Okay. Liz.
Thank you, Chair. Thank you for the NHS capacity update. It's really good to hear that St Martin's are providing extra 20 beds and the extra hospital at home and the paediatric community care hubs, which are in place till the end of February. Now, will they continue after that? Because although there is the winter rush, I believe it's going to carry on for a little while. So are there any plans to carry on with this expansion?
So, thank you for your question. Ward 4 will remain open until the end of March, and that's based on demand and capacity work we've done, which is seasonality about where we see the peak of hospital demand and when we see that reducing. There is a whole variety of schemes, including the work we're doing together around neighbourhood health, but also other elements to try and make sure that we're not reliant on bedded capacity moving forward. And I'm very happy to bring an update to a future meeting on what all of those things are. In terms of the acute respiratory illness hubs for children, they will run until after February half term. Again, that matches the seasonal demand that we see. Should there be a need to expand them for a bit longer into March, there is flexibility to do that, but we are very carefully tracking the information that we get around infection prevention and control to make sure we've got capacity in the right space. And in terms of hospital at home, we are looking to continue the increased capacity. We get really good feedback and outcomes from people who are careful in their own homes rather than in hospital. And part of the integrated community-based care, that ICBC contract is expanding hospital at home. So we're hoping to do that as we continue into April.
That's great. Thank you very much. You're going to be very busy bringing back all these reports to us, but thank you.
Maybe it'll just be a very big report. Leslie.
Yes, thank you for your report, Lucy. First of all, I wanted to ask on the mental health inpatient unit and note that they've already won an award for working with the community on that design, which is fantastic. But what will go on in the future to make sure that that co-production continues after the unit opens? It's not actually open yet, is it? So on the flu vaccinations, have you used the quality impact assessment process to identify which staff groups are less likely to take up flu vaccination? And as a corollary to that, where are the impact assessments on the ICB website? Because I've tried to find them, and unless you know the precise name of it, then all I get is this is what an equality impact assessment is. Well, I know what it is. What I want to do is actually see them. And they're supposed to be accessible. They're not really accessible at the moment. On the winter pressures and system resilience, appeal for public support is obviously a good initiative, but we did ask at the last meeting of John Palmer if he could see the results of the survey carried out in the RUH emergency department on why people were using it. And it'd be helpful to have a look at that, but we still haven't had it. I did write in between meetings, but it hasn't come through. And what was the other thing? And as part of that, then, how is the ICB ensuring that communication with the public about choosing the right service is accessible, targeted and evidence-based? Thank you.
Thank you for your question. So in terms of ongoing co-production around the Kingfisher unit, thank you for your feedback around the award we've already won. There's been really significant public engagement around the new unit and the outreach team. That will continue. We have those peer supporter roles who are working on the unit, but the group that's been set up, so they've been involved in everything from the site through to the type of bricks to being on recruitment panels for some of the staff, and that will continue. In terms of staff groups and vaccinations, I will take that back to our vaccination team, just to understand how any staff groups who are least likely to have a vaccine, what's being done to try and promote that, and I'll ask them that question. In terms of the survey, it was actually, I think you're alluding to the ICB survey, which is why people attend A&E. There is a summary of that report that I'm very happy to bring to the next meeting that details how many people are involved and what the themes were. We heard around why people present to accident and emergency. And in terms of impact assessments, I will speak to our quality team about making them more visible on our website.
Thank you. Could I just come back briefly? We did get some very brief initial results from the survey in the emergency department, but it's possible even to have the summary before the next meeting and not wait another 2 or 3 months to get it.
It's certainly been presented through the internal ICB governance, so I'm sure I can get a copy of that and circulate it before the next meeting.
Would it be sort of information that would be going to the Health and Wellbeing Board?
I will check if it's going or has been on the agenda. I will check.
Because it may already exist as a report. Thank you. Okay, thank you. Sorry, Kevin, I think you had a question, unless it's already been asked.
Mine's been answered, thank you.
Excellent. So my questions then are just really as more of a sort of general position, particularly for the RUH. It's not in your report, but I just really wanted to get an understanding of whether or not we are experiencing the same levels of corridor care that I think is happening across the country.
So, as I said we are experiencing a very difficult winter this year. There have been occasions when we've had to use corridor care for patients that is fully risk assessed, and we do everything we can with partners to avoid that. I think the important thing to remember is how we look at risk across the whole system. So we look at the risk of those individuals who are waiting for an ambulance, the risk of those individuals who are in an ambulance waiting to get into an acute hospital environment, and the risk posed to people who are in hospital for too long, awaiting a discharge. What we have been doing, particularly focused over the last 3 weeks, is really collaborative work with our local authority colleagues in social care to make sure we've increased capacity across the system to bring people out of hospital as soon as they're clinically ready, to reduce those delays, which in turn gives capacity for the front door. So it's a daily escalated conversation.
Thank you, and thank you for fielding all those questions, Lucy. And I think, well, I hope I speak for the panel in sort of extending the invitation to next meeting to yourself, but also to John Palmer from the IUH as well. Thank you. Right. We're coming to almost the last two items of our agenda. First is the minutes of the last meeting. It's any glaring errors in that? Good. Okay, then I will take it that we're happy to accept those as being correct. And finally, in the panel's work plan, obviously we've got a number of items that have been brought up in this meeting, including a wealth of reports that Lucy has undertaken to bring to our next meetings. Is there anything else that people would like to see that's not, hasn't come from this meeting, but also isn't already on the work plan? Joanna.
You said at the last meeting that you would let us know because there have been quite a few crossovers in other scrutiny panels where things didn't come to us, for instance, home to school transport, school streets, etc. And again, we've not had any comeback from you on what that is and how that's working better, because we are constantly sort of in the front line of adults and children's care services, and yet there's bits that are just everywhere else, and including housing. So I just think that how are we going to work better?
I think my commitment was to raise this at the next chairs and vice chairs meeting, and we haven't yet had that, but it is in the next week or two, isn't it? I think it's coming up anyway, Joe. So
we'll have a proper response back in March on that, because I think it's a really serious matter. Yes, we will do by then. We'll have had that meeting. How scrutiny is working and how scrutiny is working across the council.
Chris?
Thank you. Can we have an update on the schools and what partnerships they're in? Because I gather a lot of those partnerships are expanding, not worldwide, but out of county into other mats that are more, that are nationwide rather than just local. And I think it'd be quite interesting to know where our schools are going. And we haven't had anything about schools and their management for a very long time.
I think that's a very interesting question, and I think maybe we can also tie that in with perhaps an update from the regional, what are they, regional schools director?
Yeah, yes. There was a lady who came once upon a time, and she was going to come again, and we haven't had her.
Okay, all right, we will ask her if she would like to attend, or he, if their position has changed. And but I think in the meantime we could probably do some sort of list of, you know, which schools are in which mat. Yeah. I think I'm right in remembering there's only about 4 or so schools across Bath and North East Somerset that are no longer in any mat at all.
I think it's gone down to 3 now.
Okay, well thank you. Eleanor, you're not in this panel, but you can suggest something in a moment if everybody else on the panel has made their points. Oh, and we do want an update on EHCPs. Yes, we know that. Eleanor? I'm sure if it's due on the agenda, it will come at that moment, Eleanor, and I look forward to your statement on it as well. So, yeah, my very, very final point I want to make, I believe, Becky Reynolds, it's your last meeting with us. I'm sorry, I didn't realise until the meeting had started, but I'm sure we'll all like to say thank you very much for your contributions and all the help and support you have given us during your time as our Director of Public Health. So thank you. Thank you very much.
Thank you very much. That's very kind of you. Yes, I'm retiring. I'll be very sad to leave work and to leave my colleagues in particular. And I just do appreciate the scrutiny as well that this committee has given quite a few public health topics as well as adults and children's over the years. So thank you for that.
And on that note, I am going to call this meeting to a close and thank everybody